causation, poor documentation invites adverse legal inference. The documentation, RFP conduct guidelines, time and complaints, vitals and exams should be recorded, different diagnostic investigations, treatment advice, proper signature. So recommendations, treat FIS as cardiac until ruled out perform, ECG not suspect ATPTSS, record vitals and examination without exception, ensure clinically and legally defensible charge. So conclusion, ATP-MI may mute gastritis lead to preventable death, autopsy confirms missed diagnosis, ECG is a mandatory clinical screen tool in the legal obligations. Thank you.
You have not mentioned any findings of MI.
So what is the hospital needs? We don't want to. Instead of 21 years, make patient. But it's a long smoker person sleeping next.
So how do you come to a conclusion there? So that you might again make sense for yourself.
Yes, ma'am. All cases will be sent.
So what are the findings of them?
In approximately 1/3, we get findings of the late, we get findings in approximately. After that, we will give nearly 90% of patient in LAD, that is the coronary artery disease. With other elements,
Now I invite Dr. Kingsley Bhaskara sir from St. John's Medical College. The topic is deadly bar, when the geyser turns hot.
Good morning all. Good morning judges. Good morning students. So I'm the principal of St. John's Medical College, Bangalore. So today I'm here to discuss case the deadly bar when the geyser turns hot. So the case basically of a 32-year-old male, 30-year-old male, who actually visited, he is a taxi driver by profession, who visited Bangalore on a trip, and then he visited his relatives for lunch. And during that time, he had to take a shower and have the lunch. So when he went for shower at around 1:30 p.m. in the afternoon, after 30 minutes, the relatives saw that he was not responding, he was not coming out. So with the help of the neighbors, they took post home on the road, and they checked, he was found unresponsive. And following that, he was taken immediately to the nearby hospital, and where he was declared dead. And in the hospital, they also taken an EEG, and it showed that the particles of oxygen is 0% in that. And apart from that, the case came to us, and we did an autopsy at around 7 p.m. in the night, and with the following findings. So the PM hypostasis was not that visible because in this case there was some delay, and also we saw we could able to see the disclosure of the veins pinkish or the consistent conjunctiva pinkish discoloration in the scalp on exploration. And also in the anterior muscles, we also saw the cherry red with the signs being pinkish cherry discoloration. Also, we have noticed the blood. Blood was also showing the cherry red discoloration, and the lungs as well was having the same precipitation. So externally, we couldn't be able to appreciate, as mentioned in the book, the cherry pink discoloration of the ATM, but overall findings were suggestive of that, including the university. So after we have actually collected the samples for forensic science lab, and we have sent the visa along with the lungs for testing, and the blood and all the blood including stomach contents and small intestine, use of kidney and liver, along with the full lungs. They all show positive for carbon monoxide in the ultraviolet principles spectrophotometry. And the quantity in the blood showed that it had 52.5 to 8% of carboxyl hemoglobin, and so even lung tissue was also positive for carbon monoxide, and the color test was also there. So also in the FSL lab, we use this spectrometry will have Think Peak Spectra for Kawasaki finding. So the final opinion as to cause of death is asphyxia as a result of inhalation of carbon monoxide. Initially we kept it pending. After the episodes were already exceeding time. Sorry. Yeah, so we kept it. So carbon monoxide poisoning is a major cause of accidental domestic deaths, and Kawasaki causes tissue hypoxia. The very cellular discoloration of tissues seen at autopsy, may be seen at autopsy. Carboxyhemoglobin level more than 50% is usually fatal, and usually there will be symptoms like headache, dizziness, not nausea for a lower concentration. For the higher concentration, they will also have a confusion of neurologic symptoms, and this is actually confirmed by spectrophotometry, and we cover those carbon monoxide inhalation will have the carboxyhemoglobin function, which in turn reduces the level of oxygen related to tissue and decreases hypoxia and bring in the cardiac dysfunction because these have a highly oxygen these are organs with oxygen mode, and the big attention for the oxygen deficiency. And so conclusion is these actions are preventable as to proper ventilation and safety apparatus is required, and seeing this issue also concerned. So prevention is ensure proper ventilation and avoid the gas emissions. Thank you. So actually, this is carbon monoxide.
What was that?
This is a
Oh, yeah. Index finger, dorsal aspect of the index finger. What is that?
so it is this is not an electrical injury. No, this
So
is
why did you focus it?
so the pink color cherry pink color.
There is no injury as such.
no injury.
What is the normal carboxyhemoglobin levels?
So normally we can have up to 1% atmosphere for inhaled it's 8%, and for smokers it's around 20%, up to 20%, and for different people with comorbidities, this 50% can even reduce to 30% to become fatal for people with comorbidities and obesity.
So what happens in the raw? How does this carbon monoxide is produced in the gas resource?
So the improper combustion of the fuels that the diesels and the fuel in the gas.
Then the preventions, you can just show the prevention. So what is the difference between point 1 and point 2? You mentioned proper ventilation. Second, you mentioned that gas conversion in a closed space.
Because if you don't have the ventilation at all in the bathroom, it's better to avoid it.
I'm saying,
Yes, but otherwise you have to have a proper ventilation. The windows has to be there. So because in this case there is no proper windows, so that is also the cause for the because initially for sure the concentration has to be higher, but since the really the concentration but this is also great.
good morning all.
Just, you were there in the auditorium, all were there. I just thought that you missed that invitation. Thanks for you all attending this conference. It's a distinct honor for me to invite you all. It's academic space. Hope you all enjoy your stay here. Get invitations on yourself and always learn and unlearn all the things, the presentations and skits and things are there today, and please whoever participating, I wish you all the best. And I hope this will be an enriching experience to all of you. Thank you.
Respected judges, Professor Maria Siddharth Shreyas, postgraduate second year from Karate Medical College. Today I am presenting a case report titled When Rescue Turns Fatal, a cardiac rupture following by standard CPR. CPR is a life-saving intervention widely recommended during sudden cardiac arrest. Although ribs and sternal fractures are well recognized complications of CPR, fatal cardiac injuries are rare. Such cases may raise medico-legal concerns regarding the cause of death and role of the resuscitators. Case history: a 64-year-old female resident of Tanjavur, Tamil Nadu, was traveling on the Tamil Nadu Express while returning from a North India tour with relatives on 10 September 2025. According to the police inquest, the deceased suddenly complained of severe chest pain while the train was approaching Warangal railway station and collapsed. Well, fellow passengers informed the train ticket inspector who contacted emergency services. Meanwhile, following sudden collapse, attendants of deceased initiated CPR. While she was still in responsive state, a railway doctor subsequently examined the victim at the platform and declared her dead. The body was later brought to the MGM Hospital mortuary, Warangal, on 11th September 2025 for autopsy to know the cause of death. In autopsy findings, on external examination, no external injuries were noticed. On internal examination of the thoracic cavity, approximately 300 to 350 grams of blood clot was present within and around the pericardium. Corresponding fractures of the left fourth and fifth ribs were noted. After removal of the clot, two lacerations measuring 4 into 3 into 4 centimeters and 5 into 2 into 3 centimeters were observed on the anterior wall of the left ventricle, consistent with the cardiac rupture and hemopericardium. In discussion, CPR can cause thoracic injuries and lately cardiac lacerations due to forceful chest compressions. Distinguishing between spontaneous cardiac rupture due to myocardial infarction and traumatic related resuscitative efforts is essential during medical legal autopsy. In this case, rib fractures and ventricular lacerations corresponding to anatomically with the site of the chest compressions. In conclusion, the cause of death was sudden cardiac arrest associated with the rupture of the left ventricle and hemopericardium in the setting of the resuscitative chest compressions. Awareness of the rare but severe CPR related injuries is important to avoid misinterpretation of the findings during forensic investigation. Thank you, sir. She was semi-conscious at that time.
No, you were mentioning fees.
Yes.
Meanwhile, following sudden collapse, she had severe chest pain,
Yes.
then she collapsed,
She collapsed.
then the later started CPR.
Yes.
So, was there any comorbidities? 60-year-old female, diabetes, hypertension?
She doesn't have any history of cardiac disease.
Did you do histopathology of heart?
No, sir.
Why?
Actually, the disturbance they have is more to myocardial infarction. But grossly, we see it is correlated to CPR command.
Could it be a case of previous MI and heart rupture into post-MI? Followed by CPR?
Might be, sir.
How to rule such condition? Rule out such condition? Post-MI heart rupture.
We sent it to SP. We sent it the assessment to SP.
But you said you did send it.
But when we see that trauma is correlated to the CPR.
What was the status of coronary arteries?
So,
You have not mentioned that.
yeah.
You have not mentioned whether they were patent or they will never work.
They are very vacant.
How many times was CPR done and how much of pressure was it done which caused rupture of the heart?
Before approaching the doctor, they say they do continuously up for 20 minutes of CPR. Because the collapse was happening in the compartment and the train reaches to the station. It was 20 minutes time.
Okay, I would like to ask one question. You have mentioned about the dimension 4 into 3 into 4 centimeter. Yes, sir. How you are measuring? It is a cavity deep. How you are measuring the depth of that injury? Sir, how you measure the 4 centimeter and 3 centimeter?
Taper.
What is the thickness of the liquid?
So it is actually a cavity. That is the point.
And it looks like a punctured wound in the heart. The lacerated wound is caused by blunt force. It seems like the ribs are punctured and they caused the injury. So, what's your opinion?
I invite Dr. Goli Elphanate Karo sir from Mamata Medical College, Khammam. The topic is on dying declarations and clinical diagnosis, a medical legal analysis of paraquat injection in a detection care setting.
Good morning, sir. Good morning. Good morning, sir. Everyone for the day. I'm going to present the paragraph poisoning. So, provides an analysis of the paragraph poisoning and specific focusing on the elements of dying declaration. On March 17, Royce Telangana has banned paraquat poison because of its high mortality rate and lack of known antidote. As frequently involved that isolated and suicidal solution cases. So, in recent phase, the patient arrives. Patient arrives and conscious and alert, despite having a lethal dose of the system. And multi-organ failure and lung fibrosis remains to set in progressive phase. Terminal phase, the respiratory failure occurs. That the patient often remains worried and mentally clear until the very end. Patient may be medically blood, but legally fair. It creates a narrow window of dying declaration under weekly framework and related to this. It's challenging the determination of extreme state of mind, influence on mental and pain. And even with the ban, medical professionals must remain vigilant and must existing stock must be still be used. So there is a need for consultant and elevated assessment for mental fitness. That's a patient leaders right and present before the clinical condition for life.
You are mentioning the dying declaration. So let's say the dying declaration was taken in such cases, whether there is any change in course of action.
Yes, because before elucidated that it's a time from where the from state of mind is temporarily present. So in that state, if we take the diagnosis, many hospitals we mainly depend on the treatment of the patient and they progress the medical legal assessment.
So even if the medical level, the dying declaration is taken, the case will be sent for medical level also. Yes. And whether the person has consumed paraquat by himself or is forcibly given. At the time of postmortem examination, you can see assess for the injuries.
Good morning, everyone. I'm Dr. Pawan Kumar Reddy from Astrokom Medical College, Manipal. I'm going to present about a case of forensic science of complex suicide by poison induction followed by a gunshot injury. So, what is a complex suicide? Complex suicide is defined as a use of 2 or more methods to ensure death. It accounts for 1.5 to 5% of all suicide cases globally. So, complex suicide can be divided into 2. One is planned, also known as primary, and the second one is unplanned, also known as secondary. So here we are going to discuss a case about a 57-year-old male was found dead inside his car with a revolver was present over his body, and right beside to him, you can see in the figure number 1B, there was an insecticide named Victor, which is a neonicotinoid compound, and right beside to him you can see in figure number 1C, that is a suicide note which was mentioned that I am responsible for my own death, and there is a phone number underneath it. It is a phone number of his friend. So at autopsy findings which are favoring toxicology further, whitish stains were present over the mouth and greyish colored liquid fluid with abnormal perceptible odor was present inside the stomach on cut section. RFSL report revealed that there is a presence of imidacloprid, which is a neonicotinoid compound in the blood, then visceral signs. The factors which are favoring the autopsy for gunshot were the 3A. You can see the trajectory of the bullet which was present on the left side of the frontal left side of the chest. It is transversing through the heart, and you can see the figure number 3B, which shows an entry wound with a muscle imprint, which is a contact shot. So 3C shows the heart is the bullet is entering into the heart. FSL revealed that there is a presence of gunshot residue to his left hand and also on the front of chest on left side, which we did the psychological autopsy, which revealed the person is a left-handed person. So how can we interpret this? So presence of poison indicates initial suicide attempt was made. So firearm injury suggests there is a secondary method that to ensure death. So GSR distribution, which was present over his left side of the arm, indicates it's a self-infliction. Absence of struggle excludes a homicide possibility. Sequence of indicates it indicates a planned complex suicide. So studies show around 52% of the complex suicide were planned, which is in our case, and 40% are unplanned. So majority of the persons will use two methods of suicide. So as you see in our case, we also used two methods. So planned complex suicide is also defined as the victim plans different methods to ensure fatal outcome if the first method fails. Unplanned complex suicide, victim modifies the method in mid course because the first method proves to be painful or unsuccessful. So suicide note and absence of disturbance help us corroborative to rule out homicide. Psychological autopsy is essential in complex suicide cases. This case highlights about the recognizing patterns of the complex suicide. It requires a multidisciplinary approach to conclude that planned complex suicide. Thank you. Involving the fifth rib, it hit the fifth rib and it is transversing from left lung and transversing through the left side of the left atrium, right ventricle, and it was dislodged between the seventh and eighth rib posteriorly. It was present in the right pleural cavity.
It was a left-handed one or it was a homemade one?
He used this license
You
revolver.
are telling that it was a contact shot.
Yes, sir.
It fractured the ribs.
Yes, sir.
But the bullet didn't exit
No,
the
sir.
body.
No, sir. No, sir. There was a bulging which was present between the seventh and eighth rib from the back.
From Gulbarga Institute of Medical Sciences. The topic is expert witness in the dock. Challenges and preparedness of doctors during courtroom cross-examination.
Good morning, everyone, respected professors and all my colleagues. I'm here before you all to present my topic on expert witness in the dock. Challenges and preparedness of doctors during courtroom cross-examination. As we all know that as doctors, so many times we are asked in the court of law to give our expert opinion for so many legal aspects, whether we are in forensic department, whether we are in surgery department, whether we are in pediatric or in obstetrics. As doctor, we should have a proper knowledge of the subject that we all do, but at the same time, as a doctor, we are not familiarized with the courtroom environment, which is one of the main challenges at times the doctor faces. And during this cross-examination, the lawyers at times they make sure that somehow they trap the doctors so as to manipulate them and to get the answer what they want for their for the person whom they are presenting. So as doctors, we must be sure that our expert opinion, that is our expert testimony, is when we are presenting ourselves in the courtroom, it should be well presented, it should be accurate, and at the same time, the credibility of the same should be maintained with the consistency. It shouldn't be that sometime when we are called, we are giving one opinion, and then when we are called for the second, we change the opinion. It should not happen. Then, at the same time, what happens is that during this examination, cross-examination, the main challenges which a doctor faces is the leading questions and the confusing questions which are asked by the opposite lawyer. At times, many a times, the lawyer who is of the opposing party, they try to highlight the minor intricacies so as to trap us. And at times, when we are asked to explain, there are so many difficult terms which we need to explain in a very simplified manner in the court of law so that things can be simplified. So these are the challenges which a doctor faces, and I think that if it is if the doctor who is going for the expert business should be well prepared what they are going to present. They should not only rely on their knowledge, they should revise the case before going. Because at times what happens is, in a hurry-burry, there are a lot of at times the weakness of the testimony can be because of the poor documentation also. So we need to make sure that we need to improve our documentation, legal awareness, and the training of the doctor should be done so that we can have a better testimony as an expert opinion so as to support the administration of the justice. Thank you.
In the court you have attended while presenting this.
Uh,
Yeah. PG, when you're presenting this, either you have to have an experience or you should ask someone who has attended. Just mere collection of data in a scientific forum is not a good idea. So if you are told you are presenting next time, take that information from others who have attended or your experience.
Yes, sir. I'm during my first year, I have taken 2 cases with my
Two cases.
with my associate professor, sir.
So I suggest you take, proper study, take, information from others who have attended, and then you can compile like this. Just a mere thing like that, without a discussion of what others would have experienced, will not solve the problem.
Every doctor faces such kind of difficulties. It is not so. It is not so. We are always firm in our decisions, and we are well aware of the court procedures.
Yes,
You could have taken a better topic.
It was not only for the forensic point of view, because ma'am, in the forensic department, we are well versed with the medical legal aspects. But what about the people who are in the surgery department or in pediatric department? They are also one of the expert witnesses. At times, they also come when we are doing the autopsies and all. So when we need their presence, at times when we are called for someone or for a particular case, they are also the ones who accompany us. So it's this topic which I have taken up, as you have rightly said. I should have done a little more research on this. But at the same time, I have taken this topic thinking about not only from the forensic point of view, from the other departments.
Yes, Madam Nagar. The topic is handling gestation time.
Good morning, all. I am Dr. Balram Krishna, second year student, Government Medical College. I am here to present poster on this case of hanging gestation. Coming to introduction, suicide are the most common conflict issue. Hanging is the most common in India. Gestation culture are bilateral, 10 minutes, homicide. Coming to case, he is a 53 years old male with history of family conflicts. He is found hanging on midnight 12 on autopsy done on next day. Coming to postmortem findings, face is pale, its tongue protruded in between teeth. Coming to postmortem changes, cytomata is present all over the body, postmortem staining is present on the back. Coming to injuries, obliquely placed antemortem ligature mark present over upper part of the neck, which extending from midpoint of nape of neck, passing downwards to the front, and then extending to the left side of the neck to the area. On dissection of the neck, underlying ligature mark is high, white and parchment type. Iod and thiod cutters are intact. Coming to other injuries, multiple linear extension cuts present over front of chest and abdomen on both sides. Coming to discussion, extension cuts are multiple, parallel, superficial. They are present over accessible area, which support the suicide rather than homicide. Coming to conclusion, the cause of death is asphyxia as a result of hanging. Manner of death is suicide. Conclusion, which extension cuts differentiate suicide and homicide. It is very key medical legal evidence. Finally, extension cuts are failed attempts, then leading to death by hanging.
Importance of medical statement cuts in this case. He is mentioned that I think they look very superficial.
Yes.
So how can a person get such type of
Is right to
what
hanging.
what was his purpose? I mean, how to die?
So he's showing to his family, I want to die. After family comes in. With hesitation,
The most common in India. So, you know how many hanging deaths occur in a year? And if you want to get data, from where can you get that data? There is something called as NCRB. You know what NCRB is? National Crime Record Bureau. Okay, if you are presenting such cases, if you want to mention the statistics, you can get from that. And you mentioned this hesitation cuts. So, how are they produced? What weapon he has used? Or kitchen knife? Kitchen knife. Were all the hesitation cuts of the same duration?
You are telling about discussion and these presentation. What are you supposed to tell? You are finding any case anywhere in other states or in country where hanging with hesitation cuts are there. How many suicides are with hesitation cuts? What is your finding with respect to them? You have to compare. That is the discussion part. You have just mentioned the thing which is not true. So henceforth, when you do it, discussion is very important. You are finding fine, but you have to discuss with what are the other findings where the other authors have found. What are the similarities? What are the differences? And what is the reason? That is a good discussion. Then you can find out. Okay? Fine.
Good morning, respected sirs, madams, my dear seniors, my colleagues and juniors. I am Dr. Emily Muminde, second year PG from GMC Secretary. My title is about the silent strike, a deadly incident inside. Under the guidance of Dr. J. Chaitanya, Assistant Professor and in charge HOD, Department of Forensic Medicine. Introduction: snake bite elimination remains a significant cause of accidental death in India, particularly in rural settings, where most cases occur outdoor. Indoor elimination is uncommon and often delayed suspicion and treatment. Case description: a 65-year-old woman, deceased woman was brought to casualty of government general officer visited at around 3 p.m. on 21st February 2025 with allied issue of snake bite at her residence. Despite treatment, her condition was deteriorated and was declared dead at 5:30 p.m. the same day. Body was shifted to mortuary for postmortem examination. Autopsy findings: the typical autopsy findings in snake bite, as here you can see, 2 fang marks, brain, all the viscera are congested, lungs congested, liver congested, kidneys, they appear congested and enlarged. On cut section, corticomedullary differentiation is lost. In this case, as this was an elimination case, so we took for histopathological reports, we took control from skin flap from right side and tested skin flap from left palm. In histopathological report, the suggestion was histomorphological features showing fibrocollagenous tissue, congested blood vessels with inflammatory infiltrates and hemorrhagic areas. Discussion: indoor snake bite case is rare but dangerous due to delayed recognition, misinterpretation as tribal injury. Autopsy findings plus histopathological confirms systemic inflammation leading to death, highlights importance of early suspicion, prompt anti-snake venom therapy, and forensic correlation. Final opinion: based on police inquest, postmortem examination, and histopathological examination, the cause of death, to my best knowledge, is due to snake bite.
So, finding because of which you gave it as a snake bite?
Presence of 2 fang marks.
Okay.
And according to histopathological reports, there are so many infiltrates and fibrocollagenous tissue and blood vessels are also congested.
So, are there the confirmatory findings of snake bite?
And here, confirmatory signs are like fibrocollagenous tissue and congested blood vessels.
Concurrent seen in other conditions?
Inflammation and other.
If there is any injury, there is no inflammation.
Yeah.
Okay, any injury, there is no inflammation. And what type of snake are you suspecting in this?
This is viper, sir.
How?
Hemotoxic.
Why don't you think it is viper?
All the as brain and blood vessels are congested,
Okay.
kidneys are enlarged with congestion and presence of and loss of corticomedullary.
Congestion there will be very less. In poisoning cases also you see congestion. Poisoning cases also you see congestion.
Yes, sir.
Septicemia you see congestion. Good.
Okay, how do you come to a conclusion that
Hemorrhagic areas and discoloration is seen. And as it is pneumotoxic, there is presence of coagulopathy and.
Can you tell me the common sites of snake bite and why is this case presented? What is the uniqueness of this case?
Common sites, generally this case is to provide awareness. Why? Because indoor cases are more less common than
Common sites of snake bite.
common sites.
You need not tell your question. What is the statistics says? What are the common sites of snake bite? What is the uniqueness in this case? Okay, leave that. You told sir that this is non-specific, the snake bite. I think you know about the compensation mechanism. Once, if I suppose it is a natural death, disprove it is a natural death. Because nothing is specific as per you, I will just prick and tell the death is due to snake bite, just to get the compensation. How will you disprove it?
On histopathological examination and reports.
In this case, just to get the compensation, I will tell this is pan mark with a pin. How do you disprove?
Congestion.
What was the age of the patient? Who had died because of hermite?
Yeah, sir. We kept the histopathology of heart also. But for this poster, I kept only.
I invite Dr. Ananya Singh. I am Dr. Ananya Singh from KHPM's brother, Karnataka. Now, before I start with this presentation, I would just like to say one line. Take the victim as he comes. Now, my topic for today is came with fracture, departed with jaundice, delayed, death recorded. I took this topic because it was a medicine takeover case. Finally, it landed in mortuary. So, the case scenario goes like this. He was a 48-year-old male. He was initially admitted to the Department of Orthopedics with history of assault on 26th of February 2026. Initially, surgery had been planned and they were all set. Pack fitness also they had acquired. Only thing they needed platelet transfusion and they were ready to take the patient for OT. But he showed symptoms of altered sensorium, hallucinations, and ghost tremors. So psychiatry opinion was sought, and finally the patient was shifted to general medicine department, where he was kept under observation for 10 days, and all relevant investigations were serially done, and his condition was monitored. Later, on 15th of March 2026, he was declared dead in the casualty itself. Again, like after shifting to ward, again they had to take him to casualty, and there he was declared dead. And autopsy was conducted at 2 p.m. at KHPM's mortuary on the same day. Now, as per the external examination findings, the skin showed yellowish discoloration all over the body. Rigor mortis was present over the back. Rigor mortis was present only up to the upper limb. So the time since death here was 6 to 12 hours. The left arm was swollen and malaligned. That was the site of fracture. Because they were not able to intervene, they had to go with conservative management. So it was still there. External injuries were multiple contusions were there over left arm, left forearm, then outer part of right arm and the left side of the chest. Apart from that, few abrasions also were there over his leg. The internal examination findings were as follows. They showed yellowish discoloration. All vital organs showed yellowish discoloration. Straw colored fluid was seen oozing out of the mediastinal cavity as well as the peritoneum. Liver parenchyma showed micronodular changes. Stomach contained 500 ml reddish brown colored fluid, and punctate hemorrhages were seen on part of large intestine. Spleen was enlarged and cut section was failed. We preserved all vital organs for histopath, and peritoneal fluid was sent to the micro department. And initially, we only gave a provisional opinion, which was coma as a result of liver cirrhosis or liver disease. The condition was exacerbated by injury sustained. Now, I would like to go back to the point I told in the beginning. We should take the victim as he comes. So, here I am describing the thin skull rule, or the like what we call eggshell skull rule in this, irrespective of the previous health condition of the victim in this case. If the accused has inflicted injuries on him, he is liable to be punished. So he has to take consequences of his action. This person was a fit individual prior. Initial investigation, only the platelet count was 97K. Rest everything was normal. He could have been taken for OT, and even though he was a known alcoholic for last 9 years, his liver cirrhosis condition was not in the decompensated state. It was compensated. So, could he have been treated on time? Maybe he could have survived. But in this case, because of that injury sustained, first he had all the stress physiological response secondary to the left mid-shaft humerus fracture, and simultaneously delirium tremens condition, alcohol withdrawal symptom was enforced on him. As a result of which, finally, the liver cirrhosis state went from compensated to acute on chronic decompensated state, and the sequelae of liver cirrhosis started, followed by hepatic encephalopathy, bordal hypertension, and as a result, he landed in mortuary. So, our role as forensic surgeons in this case is not just the cause of death, but to link whether the injury was the trigger point for starting the causation that led to his death or not. Child Berg score, it was below 5. So he was like, ascites was not there.
He could have been operated.
Yes, sir.
There is a case of medical.
Case of medical negligence, because if despite him having delirium tremens, if they had taken for surgery and then on table death would have happened, that would have landed as medical negligence.
What was the cause of his cirrhosis being progress?
Injury itself was the precipitating factor, because it meets the criteria of causa sine qua non. Here, if the injury had not been there, he would not have been hospitalized. That is the first thing. Because of the injury, he was hospitalized. Because of that, he is a known alcoholic, as in daily he drinks. Now the thing is, last alcohol he had taken prior to his admission, that is on 24th and 25th, according to his words. And pack fitness was taken on 28th. So, according to them, already it was more than 72 hours had passed when the symptoms started. So, when they were all
taking alcohol resulted in progression of the disease.
So in this case, even the alcohol condition that had to be managed, so that they did. Medical team and the orthopedic team together, they managed the delirium tremens, and after nursing him back to the normal condition, they brought him back to ward. They were ready again to try taking him off for surgery. But by then, progressive ascites had manifested. It had become Child-Berg score C actually. Moderate ascites was there. Hemoglobin, initial hemoglobin, the first day they had done was 11.4. And by last count on 14th, which they did, was fat embolism in this case. Has to be there for fat embolism also. This is already 15 days admission case. On basically the 17th day he passed away. Already the time limit has gone. On top of that, we had preserved all vital organs: brain, heart, both lungs, both kidneys. In heart, they didn't find any embolus as such. Histopath findings were consistent with the cirrhotic liver cirrhosis findings. Postmortem examination report.
PM report is not.
Good morning, everyone. Myself, Dr. A. Mother, second year postgraduate from Osmania Hospital. Today I am presenting about the vehicle killer, domestic electrocution with fatal outcome. Coming to case history, a 35-year-old this is a case of 35-year-old woman with alleged history of electrocution. She was brought to the hospital
and later declared dead. On autopsy examination, injuries, electrical burn injuries present over the right index finger and right great toe. Coming to internal examination, all regular organs are congested. Critical hemorrhages are present over the anterior surface of the heart. And the features is suggestive, but do not consider to the cause of death. $50 grams of muscle tissue considered for the histopathological examination. These are histopathological findings: muscle fiber necrosis, loss of class dilatation, fragmentation, inflammatory included, features are suggestive of rhabdomyolysis. General rhabdomyolysis occurs due to muscle damage caused by electric current. Conclusion: LPU findings of rhabdomyolysis support the death due to electrocution and its complications.
What histopathological sample you are to say? When your electric contact points are visible, why did you send this electric contact point for histopathology? Rhabdomyolysis is it a pathological finding of electrocution? Question: rhabdomyolysis, is it specific for electrocution?
To confirm the
You would have said the skin samples, isn't it?
skeletal muscle.
No, that would have the electric burn injury. That you should have said for histopathological examination. Okay. And you don't have any references?
Dr. Venu, you tried your best to make the presentation nice, okay, and you could have brought. But thing is that, can you tell me whatever the images you have given, first thing you have not given a level for right, the extreme one, first one. What is the purpose of putting that image?
Which one is this?
No, on your right first, on your left first. This is opinion for you. Probably will do the conference organization. Okay.
Presence of your sir and ma'am. And we'll continue for the faculty presentations from now. And the judges of the sessions are Dr. Vinay Gujan Shetty sir, Professor and HOD ESIC Bangalore, Dr. Ambika Prasad Tata sir, Professor and HOD Jitla Pondicherry, the Tertiary Care Institute in the Andaman and Nicobar Islands. I welcome you, sir.
Yes, good morning everyone, respected judges, dear colleagues, students, postgraduate students. I'm Dr. Ashwini Kumar, Assistant Professor in the Department of Forensic Medicine and Sport Care. I am presenting a study which is medical legal analysis of homicide cases at the Tertiary Care Institute in the Andaman and Nicobar Islands. So, to the people who don't know, the Andaman and Nicobar Islands is divided into the northern and the southern group of the islands. The northern group comprises of the Andaman group of islands, and the southern group is the Nicobars. The northern group holds India's only active volcano, which is the Barren Island volcano, and the northern group also holds the Sentinel Island, which is the only island which is not permitted at all. No human beings are permitted to enter this particular island. You all must be aware of this particular case, 2018. This individual had tried to approach this island. He had actually landed on the island, and then ultimately he was killed by the Sentinel tribes. So the reason I put this case was this particular image was, although it is a homicide case, it is not considered as a homicide. Hasn't come into our statistics because there is no corpus delicti. The body was never recovered in this particular case, so he never became part of our statistical analysis. The southernmost group, this is important. So this forms the southernmost part of our country, that is the Indira Point. You can see the lighthouse over there. Moving on to the introduction of my topic. So homicide, as we all know, is nothing but the death from purposefully inflicted injury by another person. This is as per WHO. As per the NCRB data of 2023, which was released in late 2025, 37,495 homicidal deaths had occurred in India. This is a 28% increase nationwide. Autopsy studies in this manner, they offer unique epidemiological insights into victimology, lethality patterns, and they bridge the gap between crime scene data and effective prevention for the future. The aims and objectives of my particular study is, this study is the first focused medical legal profile from this remote tertiary care center, which is located in the Union Territory of Andaman Nicobar Islands. And the objective was to analyze the profile of homicide victims in these islands to understand the distribution of homicide cases according to various parameters, such as motive, number of offenders, relationship with the assailants, and many more. Coming to methodology, it was a retrospective descriptive analysis. Study period was between 2016 to 2023. Total samples, the total number of videos collected during this period was 1,617, and the total number of homicides during this period was 45. So the inclusion criteria was all cases brought by the police with history of homicidal deaths. Exclusion criteria was all other cases of unnatural death or which were brought death. This is the study site. This is the mortuary of our Vivipal hospital. Methodology involved a relevant extraction of relevant data from the postmortem reports, police inquest forms, and whatever relevant data was there, it was extracted, maintaining anonymity. And all of this was obviously done after getting the institutional ethics permission. Subsequently, it was entered into the Excel and analyzed using SPSS technique, and various other references and comparative studies were reviewed before doing this step. Coming to the results of our study. So this shows the year-wise distribution of cases. So 2.69% of deaths of our study, of the entire sample size, were due to homicidal causes. This is a gender distribution. As you can see, there is a female predominance. Okay? So this actually is a very unique feature of this particular study. Most of the studies, they indicate male predominance, whereas in our study there was a female predominance. The age distribution, 31 to 40 years was the highest age group. This again is a variation wherein most of the other studies, they report 21 to 30 as the higher frequency. 71% of the individuals were married. So most of the cases had occurred in married individuals. This is the distribution of homicide cases as per the time, the month of incident and the place of the incident. Evening time was considered as the most common time of occurrence. The months, if you notice, these are all the off-season months. These are the months when the tourism doesn't actually occur. So probably this has some bearing on the domestic issues. The place of incident was domestic. It was at home. It was at residence. So this was also one of the findings in this study. Moving on to the distribution of homicide cases based on the motive. In a large number of cases, although the motive was not known at the time of PAV, as per the request form submitted by the police, domestic issues turned out to be the other major contributor of the cause of death. The number of offenders in most cases was a single individual. Then the relationship with the assailant turned out to be the family member, the whole family member. And in 15.6% of 7 cases, the husband was the accused. Moving on to the distribution based on the survival period. So broad death or on-spot death. So this was about 64.4%, which is again higher in variation compared to the other studies. This is the survival period after reaching the hospital. So this contributed about 35.6% of the individuals who had died after being admitted in the hospital. Then this table shows the fatal injuries, the cause of death, and the type of weapon. So you can notice that the head and face and the neck, they are the predominant sites which are attacked. Head injury was the most common cause of death, followed by hemorrhagic shock and asphyxial deaths. The other type of weapon was the sharp weapon, which was most commonly used. Again, because it was a domestic issue, most of the weapons which are there available at home could be kitchen knife or knife. We have large weapons, sharp heavy weapons like sickles or dowels which are got. So they are usually available at home. So this is the type of weapon which was used. Then this is the cross separation chart wherein you are able to see the blunt weapon to the to the different body parts that contribute to about 15%. Sharp weapon to different body parts contribute to about 17 of the total cases. Then coming to the discussion of our study, so as compared to all the other studies, the main difference in our study showed that the gender was very clear outlier. It was a very clear standout feature. It showed a higher female victimization in the island setting. The age peak showed slightly older, the model age, which was 31 to 40 years of age group. There was a much higher domestic setting, strong domestic motive, and the highly intimate partner or family violence. So this was one of the key features in this study. Moving on, there was a lot of married victims, the domestic weapons, as I just said, and please notice that there are no firearms which were used in this, in the entire study period. As in, there is absolutely no contribution of firearm injuries in this particular region. Main reason is the difficulty in procuring firearms in mainland India. Country firearms are very easily procured, but here it is very difficult. So this contributed to completely, zero firearm injuries. Neck injuries were more frequent. There was a faster fatality rate, about 64.4%. And the temporal pattern, which was evening peak, was consistent with the other mainland cases. So to conclude, the Port Blair study, it reveals a distinct domestic island homicide archetype, which is female-dominant, home-centered, sharp or blunt weapon driven. This is in contrast to the male-dominated public or conflict-oriented patterns of mainland India and other South Asian countries. Although the present study is very limited by sample size, it is a critical geographic gap and highlights how isolation modulates violence expression. Forensic medicine specialists and policymakers must tailor interventions to local social geographic realities to reduce preventable homicide deaths in the future. So with this, I conclude my study. These are my references. Thank you so much. So, evening peak and the other thing was off season. So, wife or fighting with the husband. So that was one factor that we noticed. So that was very commonly student.
Thank you for a nice presentation. Actually, looking at your sample size and incident out there, what is the objective? What was the objective of making this study? First thing, what way this study is novel compared to the other studies?
There's no analysis which is made from Andaman Nicobar Islands till date. So that was the main claim. The other thing was this was never a reference, so this can now become a reference point. We have many references from mainland India. We never had one reference point from Andaman Nicobar Islands. That was the main thought process for this study.
You did not cite it.
The references. Yes.
Okay. Any other questions?
Actually, it's a very good presentation, sir. It was excellent. No doubt. One clarity is you told all the this thing was taken from the police inquest.
Yes.
Did you find any cases where the police told it is suicide but it was murder, and vice
We
versa?
haven't. So we have not received summons yet. So initially they were registered as 174 or 194. This was all before BNS. They were all registered 134. So we reported them as 302. Okay, so this one particular case that I did happened, they got it as 174, unnatural death. Turned out to be smothering strangulation case. I got the summon for that case later on in maybe I think early 2024 or something like that. So in such cases, there's nothing that we initially gave our opinion as it was throttling and it is a 302. But the legal procedure takes time.
In relation to the social economic status of the victims,
Fall between the median age group, the median they are not very below poverty line because Andaman Nicobar Islands technically there is no below poverty line in Andaman. The local population is very well kept by the administration. So there is nothing like BPL or anything.
Other victims, tourists were there. Victims, tourists were there.
Tourists were not there. There were no tourists in this.
Tourists there were mostly they died because of drowning over there and.
No, there is a mixture again. In tourist deaths also there is a mixture. Actually, we had only two, water sport related deaths.
Okay, water sport.
So I had one study on tourism. So that also was the first study on tourist deaths throughout India. So that established, that tourism in Andaman Nicobar Islands is relatively safer than other international countries.
Okay.
So that study I had done previously.
I invite Dr. Senthil Kumaran Sir, Associate Professor, AIMS Madurai. The topic is Comparative Perception of AI-generated and textbook explanation in forensic medicine education among UG students, a pilot study.
Good afternoon to one and all. So the topic was comparative perception of AI-generated and textbook explanation in forensic medicine education among undergraduate medical students. It is a pilot study. And background for this study is the integration of artificial intelligence is reshaping medical education. And this growing reliance on artificial intelligence is challenging traditional learning methods which we used to study from books. Most probably the students are now over-reliant on AI. Students increasingly use a chatbot for few answers. When we are studying, we used to go to library to check textbooks or something like that. Now everything they can get it from AI. There is no limited comparative evidence. Few studies compare AI-generated and textbook-based content, whether both are similar or the gross variation is there. Accuracy with a simplicity trade-off. AI is easy to use, but concern remained about how accurate the answers the students were getting. And the main strategy objective for this study is the pilot study aimed to compare undergraduate medical student perceptions of AI-generated explanation and standard textbook explanation in the understanding key concepts in forensic medicine. How reliable they can go for AI chatbots. The study design is a pilot-based study which has been approved by IEC company. Then they have conducted this study and chat AI platforms we use the ChatGPT, Perplexity AI, and Google Gemini. These are the major chatbots we have used. And comparison result, AI explanations were compared with standard forensic medicine textbook. This branded evaluation was done using anatomize to reduce bias. And how the assessment were done. So answers were given from 3 chatbots and also from textbook, and all were correct answers. Just we asked which is more suitable for you, which you understand in a proper way. Either it is a chatbot or a textbook reference based on clarity and simplicity, depth, and overall preference. So when we compare AI use awareness and usage patterns, how often do students use chatbots for studying? Mostly it is frequently used by more than 60% and rarely some percent. And which chatbots they use most frequently? Mostly the students gave answer as ChatGPT followed by Gemini and others. And study preferences, how do students prefer to study forensic medicine with textbook and AI chatbot or a combination of both? And mostly AI chatbots alone, since we have asked the question, they are afraid of answering this question. Might be they said both equally. And someone has said textbooks and AI chatbots for fast clarification. For quick clarification, it is overwhelmingly all the students have said like for quick clarification they use chatbots. And detailed depth answering, they go for traditional textbook. When they want to study deep, when they want to show figures and pictures, they go for textbook. And for preparing MCQ question-based studies, it is always chatbots followed by traditional textbooks. When we ask the question whether AI chatbot saves the time in reading purpose, it is mentioned that it saves time. Most of the 90% of the students have given this answer. So when we compare AI with textbook reference, AI prepared for simplicity and speed for quick understanding and MCQ practice, and textbook was prepared for detailed understanding. When we ask perception of AI chatbots. We use Likert scale response. These are the questions we have given. AI chatbots make learning easier. Most of the people strongly agree with that. And AI chatbots provide quick explanation. Everyone accepted. Chatbots used for supplementary tool accepted. And AI chatbots important for future manipulation. Everyone accepted. Only problem is this question that the students were neutral. Information from AI chatbot is reliable in academic learning. So they were very perceptive with this one. And there is a divided opinion. Then we have prepared some 15 questions. And 15 questions we have given 4 options. So for example, what is the estimation time limit or what is corpus delicti? So we have given all these questions and we have given this in chatbots like ChatGPT, Perplexity and Gemini. What answer it is giving we have put and what thing they have provided in the textbook. We have provided the textbook answer also. And in order to not follow a standard thing, A means chatbot or B means Perplexity, C means Gemini, we have mixed matched it. So colors I have mentioned. Red color one is ChatGPT, blue one is Perplexity, and green one is Gemini, and the black colored one is a textbook. So we have combined these things and we have given the students in a Google form and they have to pick the answer. Based on that, most of the students have preferred like AI generated answers they were ready to accept and there is a clarity easy for them to understand. Out of 15 questions, AI generated gone for 12 and textbook for 3 and out of AI platform is ChatGPT 9 and Gemini 3. So statistical methods, we want to compare the association between the questions. It is statistically significant. And strength of association between questions, it is moderate to very strong. Since it is a pilot study, the Cronbach's alpha stands at 0.78. It is acceptable for pilot-based study. And in conclusion, AI is used as a supplementary tool. Useful time-saving supplements. It can be used as a supplementary tool, but textbook remains a gold standard for deep and rigorous learning. And the future will be the best approach is hybrid learning. Since we are moving forward, we cannot tell like AI you cannot use, only textbook we can use. So it should be an hybrid approach in future. And future scope, large multicentric. It is a small pilot study which we have done in our institute. So it has to be done large multicentric studies and measuring learning outcomes and evaluating factual accuracy, what the study has been doing, and developing AI integration guidelines, institutional guidelines for responsible AI use, including context limits and verification steps. And these are my references. Thank you.
One thing is, in your conclusion, you have said textbook remains the gold standard.
Yes, sir.
It is a presumption from the outcome.
From the outcome, what students? Okay. For quick reference, they use AI chatbots.
Okay, so.
Questions are mainly forensic case questions.
Okay, so in that case, do you expect one bias response to
Yes, sir. That's why we want to do in a multicentric study and other subjects also we want to go forward. The color coding. So A, B, C, D, sir. So one of the options will be from ChatGPT, one from Perplexity, and one from Gemini, and one from textbook, sir. So if you give all A in ChatGPT, students will be easily picking ChatGPT. So we want to jumble these things, sir. So 15 questions we have jumbled, and color coding I have done. So it is easy for.
So color coding is for you.
For my reference, sir. I will be giving in a Google form in a jumbled list.
But this color coding in a way may have the influence over the reader.
Yes, sir. That is the future, sir. This is a pilot study. We want to take further to future years and other departments.
9 students will use 3 skills. ChatGPT and 3 students Gemini.
Yeah.
Perplexity, could it be the reason because it's not free?
Not free, and one more thing is, I have been using ChatGPT and Gemini for quick reference. I have not used Perplexity. So I have not searched my related teaching topic in Perplexity, so the answer will not be proper. If I started using Perplexity more, answer will be more relevant. More they use the ChatGPT, more reliable answers will be.
It is a pilot study.
Yes.
I think we have witnessed that students are not using the textbooks nowadays.
Yes.
They get a tab and they'll switch over to the AI.
Yes.
But then there is a bridge in between these two. That is a PG teaching. So whenever they enter MBBS, nowadays they are not writing with textbook at all.
Yeah.
They will get it from Bhatia or some PG Marrow notes.
Yes.
Because it is pilot, in your future study, you can add that as well.
Yes.
Because most of them they are reading that instead of textbooks. You can add that perspective as well in your future studies.
Yes.
Right.
If they want to study deeper and they want to refer some pictures related to forensic medicine, they go for textbook. But it's just like if you ask some question, what is Casper dictum? If they want to check, immediately they are checking in chat box and telling the answers, sir. And
But do you think that is a really unbiased answer? Looking at the pattern, physically what we observe, the way the response came from
yes, sir. It depends on how much they are searching for the answer related to forensic medicine while they are using, sir.
So
that's why I have not made them to enter the question and get an answer. So I have made myself to put the question and get the answer from all the chat groups.
Okay, so whatever the questionnaires you have developed, those are pre-tested questions or?
Yes, sir.
Okay.
Yes, they are validated and done to
Will you use any, yeah.
We also develop, since we are developing an MCQ question, we only develop and our answers we have validated. Thank you.
Thank you, sir, for your presentation.
Actually, good afternoon, all of you. I am associate professor, otherwise my sir, sir will be the first notice. And next thing will be, this is a study conducted in Hillpark Medical College, because we being in the private college, we are not doing any autopsies in Tamil Nadu anyway, except Ramsar community. And so this deficiency will be overcome by whenever our PGs are posted for 3 months each year in respect to district hospital or KMC, we try to do one of our studies. So this was a part of a study conducted by our PG Hariharan, and he did in this hospital he was posted in Roypeta. This is a hardcore place for criminals. So if you are seeing a movie like Vada Chennai, North Chennai, this is part where all the big gangsters are there. And invariably, each month we will witness 4 or 5 horrible cases. That's why my topic heading will be highlighting some horrible or horrendous cases. So, according to NCRB, so each year we are witnessing some significant number of homicides. And if we say murder rate is 2 per 1 lakh population, and each hour we have 3 murders in our country. So when we live in a society where all kinds of individuals with all backgrounds we are interacting or mingling. So naturally there are scope for revenges, vengeance, and so many social stresses, how they handle depending on their capacity and knowledge. That's why we have to find the real reason for such homicide, what are the provocation or the intent, and accordingly take some actions, not only actions, but preventive strategies that they are most useful. So we rely on NCRB data, and of course our BNS and BNSS guide us in handling such cases, and we try to analyze the trends in homicide because it helps in our strategy and policy making. So we conducted the proforma, including all the demographic profile and sources of information collection from police reports to our autopsy reports. And we found that among the demographic, the age group 21 to 30 was the most affected, almost 60%, which is very significant that these youth are really the most affected, the vulnerable, and prone for such heinous attacks. And there were 36% were illiterate, and you can note down 53% were belonging to low socio-economic status. So that is a big stressor where we need to address the education and economical status. We should. And unemployment affected in 58%, personal wages was the motive in 30% of cases, and other cases were only in provocation in smaller proportion. And the cause of death was in multiple injuries to
many parts of, especially the head and neck, followed by stab injuries. So this is a graph which depicting the motive behind. And in fact, personal vengeance is almost half of the cases, the revenge part. And gang rivalry, it depicts a regional picture of how much gang rivalry is there. And the causes of death, simple shock and awe is due to many of the blunt force injuries. At the same time, there were sharp cutting weapons were used. But ultimately, the other forms like asphyxia due to throttling and strangulation, they were very less. And poison injection was almost only one case. So, as I told, age group, youth in their prime form, they are mostly vulnerable. Marital status, again, it mattered. You find 61 of victims were married, so they would have some marital issues. Personal vengeance was in 31%. So our study aligned with some of the forensic literature in the print. That means it was more or less each region have a different stereotype kind of causation and the pattern. So, but they are important mainly to arrive at the manner of death, and this is what I wanted to highlight. So again, youth involved in a gang rivalry. So gang rivalry means there is no need for more explanation here. So these are the kind of chop wounds both in the head, neck, and shoulder regions. And in case number 2, it was simply an act of provocation. It was like on spot when somebody used a locally available sharp weapon and has cut him for the limbs and on the head. And of course, this was a planned murder with a cutthroat injury. You can see multiple initial attacks were on the face, and once the victim was silenced, again, once he was found unconscious, again cutthroat injury is there, and you can see that tattoo marks the indicative of some background, a criminal background, most likely, I'm not sure, but in the study they give some indication. Case number 4, we have got multiple scalp injuries to back of the neck. So similar to cutthroat injury in the front, the neck we have got at the back. So that shows the kind of weapons, the plan, and then the criminals know where to attack, when to attack, and how to attack. This is one part. Of course, this one doesn't fit into this horrendous case, but still, when a mother kills her own baby, it's a very wrong message to the society. That's why I wanted to highlight this particular mother, in the very first month of baby, on the pretext of giving the sunlight, the phototherapy, she took to the balcony and she slipped it purposefully and let the baby die. A female child, and once the husband came to know, once the case was filed, she pretended that it slipped from her hand. But then, on proper interrogation and she admitted that she didn't want to, it was a stress on her family, she wanted to get rid of it. And ultimately she wanted to take a pretext of puerperal psychosis, but there were no signs of any puerperal psychosis prior to this act. So the implications we need to know, and we need to take corrective actions. In this regard, state must strengthen the law enforcement. Community programs help in the cause, not only to act at the root levels, but to alarm or warn the population at risk. Legal awareness is important, which is nowadays can be given in social media also. And further research should explore the socio-cultural factors and preventive measures. So ultimately what I will say is crime monitoring and strict implementation of the law are the answers for such avoiding and curtailing the homicide rate. So in conclusion, in spite of this limitation of a small sample size of 47 cases, the study concluded that homicidal deaths are relatively common in this part of South India, in Chennai region. Compared to the other unnatural deaths like suicide to other, they are relatively not very high. Most common age is the prime youth, and the nature and pattern of injuries are crucial to arrive at the manner of the injuries. manner of death, which is important in the court during the argument. And an in-depth knowledge of injury causation and causative factors is essential for both the court and the police in providing a criminal justice for a better comprehension of murder. That's all from me. Thank you. Sir, it was one by name Jalla. Jalla is, I think, OP poisoning. No, not sure about the subclass. It was mixed to a young lady by her PG mate. How she was found? On the way to her job, she collapsed. She was clueless, and she was taken to a nearby juice center. Given by the time she had already collapsed, the juice also might have caused some aspect with choking. I don't know, but later found that there was a sample and no signs of any suicidal intent was there or history. And her roommate who had quarreled over some issue, whether it was boyfriend related or other financial issue, we are not sure. Investigation, couldn't dwell deep into the history. But the roommate she accepted. I mean, she was found to be the perpetrator in that case. IT girl and the roommate.
So what happened to the mother then?
Case was filed and husband also was against her, sort of in putting the case. She underwent to lawyer. Lawyer gave the pretext to take the peripheral psychosis, but she was totally with the neighbors and her husband. She never showed any signs of psychosis, as per the later interrogation. And her main intention was to kill the female felicide.
Fetal death. In Bernard Wright, the author describes a couple of cases where the baby dies by accident. But later on, the mother, due to the immense sadness of loss of the baby, she builds up a lie and builds up a statement that I was
early morning 9 to 10, the child has fallen, but she reported the case at 1 p.m. to her husband. When nobody found in that area, so she reported by 1 p.m. When husband came later, evening only case was filed.
Yes, sir.
This was an indication. Otherwise, definitely she will immediately go down and spill the alarm.
I would like to call upon Dr. Gerard Pradeep Lerla, sir, Assistant Professor at AIMS Madurai. The topic is medical legal aspects of ova theft or illegal ova extraction in India.
Respected judges, faculties, delegates, and postgraduates. I want to just, it's a narrative review about a very small issue about even made occur as a small issue in this infertility treatment that is happening in India. There's a unique thing that's going on, what is called as ova theft. So with the background on cases in India, I just want to describe about what are the lacunae and what's the role of a forensic expert when it comes to ova theft. So introduction, we will just going on to these things, what's an ova theft, why ova theft is happening in India. So all of us are very accustomed to the illegal kidney racket. So like that, because kidney is a big organ, all are focusing on that, but still an illegal ova racket also is going on, which we forget to look out upon because it's a small cell and it is of less market value. We will see the case discussion, what are the ethical issues, and what's the role of a forensic expert when it comes to ova theft, and how we are going to prevent it and the conclusion. So another very important thing, what is an ova theft? So if I donate an ova for an IVF center, this is because of pure consent I give it. But if I don't follow the standards or the guidelines given by the ART Regulation Act, that was the final updated one in 2021, if I do anything which contravenes that act, then it calls as ova theft. So ova theft is an illegal ova donation, refers to the unauthorized, forced, and unlawful retrieval of an woman's egg in IVF procedures in violation of the ART Act. First, I go to the very important point, what drives this illegal trade. As you know, it comes to organ trading with kidneys. Similarly, the demand is more. So in India, there is a need for around 10 million cycles of IVF procedures. All of us are aware that a couple has to go for multiple cycles to have one successful outcome. So the demand is more. So, but we are doing only around 1/3, that is around 3 to 3.5 lakh cycles per year. So there is a gap.
Education, innovation, and research of our participants. This platform brings together ideas that inspire learning and meaningful discussion. With that, I would like to introduce our esteemed judge panel for today, which includes Dr. Devraj Patil sir, Professor from ESIC Hyderabad, Dr. M. Prashant sir, Associate Professor from AIMS BP Nagar, and Dr. Chaitanya Mittal sir from AIMS Patna. Thank you all sirs for being here and making a valuable contribution to our session. As we start off with today's presentation, we would like to brief you regarding the presentation rules. Each participant will be given 5 minutes to complete their presentation with a bell ringing at 4 minutes, indicating that the last 1 minute of the given time limit is left out. This will be followed by a Q&A session for 2 minutes by our panel. With that, I would like to welcome onto the stage the first presentation of today by Dr. K. Ravalika Ma'am from RIMS Hyderabad about postgraduate training challenges in forensic medicine. Please. Hence, it is proposed that a structured curriculum be established across these departments. FMT faculty may be posted to these areas so that postgraduate trainees can undergo training in a guided manner without the sense of being external observers. In the present situation, the number of FMT faculty is very limited. The requirement for additional faculty members under this curriculum may be difficult to implement in practical terms. However, if this is effectively implemented in the future, this framework would contribute to advancement of FMT. It would support the development of competent forensic experts, thereby strengthening the administration of justice. Such improvements may also positively influence conviction rates. So, conclusion, the implementation of a structured and well-coordinated multidisciplinary training programs is essential for strengthening postgraduate education in FMT. So it enhances the competency of PG trainees and improves the overall quality of medical legal services, which supports the effective administration of justice. Thank you.
There are a few things were missing in your PPT, like references. So you should add a references, and even you can thank the organizer. So these are like basic presentation ethics. Okay, so you should always acknowledge first, and you should have references, and even you can quote, and you should have an interaction with the audience also. Like you will keep on like focus on the screen. At least once or twice minimum should focus on the like audience and interact. Okay. So, no question from my side. Any question from the audience?
Ignore it. I could have added regarding clinical forensic units.
Okay,
Apart from archery, the forensic people also be involved in clinical forensic units. So that would have been much more better. But anyhow, nice.
This type of presentation, I mean, what is the article? The review article or what did you do? What did you gather all this information?
RMP is like a collaboration with integrated collaboration with other departments, makes the PG trainings more effective and also makes the forensic expert opinion accuracy increases. So that's what my.
So entire Telangana to entire India, people are going to other departments, other institutes outside of institution.
Exactly. But
there are a lot of other things you miss. As a part of training, assessment is also important. You didn't cover it. You only covered about the posting, only about the posting point you covered. But apart from that, and you think the curriculum is also not appropriate.
It's appropriate, but if we follow that curriculum appropriately, it would be so great. That is my opinion.
So the challenge is limited to your institute.
It's indicating that last 1 minute of the presentation is left and will be followed by a Q&A session of 2 minutes. We would now like to welcome Dr. B. Saad Kirti Ma'am from GMC Nizamabad about her presentation, Tracing the Fatal Path, a case report. Respected Chairperson, judges and all the dignitaries, a very good morning to one and all. Myself, Dr. Sai Kirti from Government Medical College, Nizamabad, second year postgraduate. Today my case presentation is about a case report which we encountered in mortuary of TGH Nizamabad. Starting with the introduction, firearm fatalities present a unique practice, particularly in rural or transit corridors where country-made weapons are prevalent. These weapons do not follow predictable ballistics of factory-made firearms So this case highlights the importance of forensic ballistics, specifically terminal ballistics in the reconstruction of a fatal head injury case, which is nothing but a triad of history, external morphology and internal trajectory. Coming on to the case details, a 35-year-old male lorry driver by occupation was transporting wheat from Jabalpur to Karnataka. He halted at a roadside dhaba to meet his brother and after a brief interaction, proceeded back towards the parking place where he had parked his lorry, and there he was attacked by two assailants who assaulted him with a rod over the lower limbs. Subsequently, he was shot using a country-made firearm. Then the victim died and the body was brought to TGH mortuary for autopsy. And on autopsy, an oval-shaped firearm entry wound was noted over the frontal region of scalp, measuring 1 into 0.8 centimeters cavity deep, located 7 centimeters above the sternal notch, 7 centimeters above the glabella, 23 centimeters above the sternal notch, 15 centimeters and 13 centimeters medial to the external auditory meatus of left ear and right ear respectively. Margins of the wound were inverted with a surrounding abrasion collar and blackening was present. Associated split laceration was present in the 12 o'clock position, measuring 2.5 into 0.7 centimeters. This is the picture of the firearm entry wound with associated split laceration at 12 o'clock position. And surrounding, we could appreciate the blackening also. And other injuries that were noted in autopsy were patterned contusions present over the anterior aspect of right thigh in the lower one-third, contusions over the anterior aspect of left knee, abraded contusions and contusions were present over the toes of left foot. Lacerations were noted over the left great toe and fourth toe of left foot with underlying nail injury. The picture showing the same, and the second picture shows tramline contusions over the anterior aspect of right thigh. And viscera was sent for chemical analysis along with the bullet. Skin tissue over the entry wound was also sent for chemical analysis to FSL. And internally, the wound track is directed posteriorly. There is perforation of the frontal bone, dura mater, with laceration of the brain parenchyma. And the projectile trajectory terminates at the inner table of the occipital bone on the right side, where the projectile is lodged. This is the picture. The first picture shows the entry wound after opening the scalp, that is on the frontal region of scalp. And the second picture shows where the projectile is lodged, that is near the occipital region of brain. This is the cartridge projectile which was recovered from the body of brain of the deceased. The seized weapon was identified as a country-made SBBL pistol with combustion residues detected in the barrel, which confirms firing. And the other cartridges were recovered with 8mm caliber rifle cartridges. Also, one empty cartridge was recovered, and both were fired from the above seized pistol. Test firing was done. Comparison findings like firing pin marks and scrape marks were present. They matched the prime bullet as well as the test fire prime cartridge and as well as the test fire cartridge and bullet also, confirming that the seized pistol was used in firing and it was a sign of recent firing. Skin piece examination reveals entry wound with inverted edges, copper and lead traces were present, confirming that bullet impact and gunshot residue was present. Human blood was detected on the bullet found in the skull of the deceased. SBBL pistols are single barrel breech loading guns, primarily 12-bore shotguns, India made for self-defense, security and agricultural protection against wildlife. These are the weapons that were seized and the cartridges that were recovered. Starting with the case discussion, in the present case, we encountered a fatal gunshot injury to the head. The autopsy findings, ballistic principles helped us to arrive at a scientifically sound reconstruction of the trajectory and interpretation of range, weapon characteristics, as well as manner of death. The presence of split wound at 12 o'clock position indicates that massive volume of gases which were produced due to the combustion of propellant, they forcefully followed the bullet into the wound. When these gases cannot expand outward, they created this split laceration. They lifted the scalp and caused it to burst against the muscle, creating a split-like appearance, nothing but the blowback effect of gases, which is suggestive of a loose contact wound. Also, the presence of blackening around the entry wound is another important feature which is suggestive of a loose contact wound. And weapon identification, the bullet here did not exit despite being a headshot, that to a close contact wound. This is a hallmark of low muzzle velocity associated with country-made firearms. Country-made firearms are nothing but smooth or poorly rifled bore weapons, leading to tumbling effect of the projectile and can cause larger than expected entry wounds or irregular internal damage, which is found in this case, giving us a clue about the weapon. Also, the ammunition used in country-made firearms is frequently improvised, leading to incomplete combustion of the propellant, which gives more irregular soot deposition and even unburnt powder grains. Also, here, the projectiles from country-made weapons often lack the gyroscopic stability, so this causes the bullet to tumble or yaw, entering the brain, creating a wider permanent cavity or laceration, causing the bullet to lose its velocity, and so it is found lodged in the brain cavity rather than exiting out. And direction, the case, based on the findings, it gives a clue about the direction, like reconstructing that the victim position, he was likely in front of the assailant, facing him, which has given the posterior direction of the track. This is the picture, 3D facial view, CT scan, like showing the frontal and occipital regions. Manner of death, based on the site of firearm entry wound, that is over the forehead in the frontal region, less likely to be a suicidal firearm injury. We can come to a conclusion it might be a homicidal case, and also based on the multiple blunt force injuries. And the internal wound track where here bullet entered the frontal lobe and lodged in the inner table of the occipital bone on the right side. The sequence of events like contusion on the thighs and legs, so blunt force from rod and laceration of the toe suggestive of a pre-ballistic struggle, and probably the victim was struck down or immobilized first and then a fatal shot was delivered in a vulnerable position, and the position of the victim is posterior direction of the wound track suggests that the victim was likely facing the assailant. Concluding this case demonstrates a classic homicidal triad where physical immobilization followed by a loose contact range firearm execution and recovery of the projectile from the occipital bone provides a final link for ballistic fingerprinting at FSL, and the determination of the manner of death in this case relied on the correlation of circumstantial evidence, external morphology and internal trajectory. Range, weapon characteristics, direction and manner of death was made possible with the use of terminal ballistics. These are my references. Thank you.
We have one practice for the time part, 5 minutes should be covered. Okay, now coming to your slides. So we have shown the entry wound.
Yes,
so the picture should have a bony landmarks. Okay,
yes,
so you know it. Pictures are for third person.
yes.
Okay, so like you are presenting here. So if you are not told, it is difficult to tell it is on the frontal region or not. Okay, should, as you told, you have included the glabella or the eye fronts. So picture should be having at least one bony landmark. Okay, like a digital table. Can you explain? Yeah, you have to explain.
After the entry wound, sir.
Okay.
Like the entry wound was present over the frontal region. After that, blackening was seen surrounding the entry wound, and in the
No, you didn't get it. So I am asking the term. Can you explain the beveling?
beveling, like on the outer table, there was punched in appearance was seen on the outer table, sir, near the entry wound. Beveling was present over the inner tables.
That is important finding. Whenever there is about the skull and firearm, you must take a picture of beveling. It explains clearly about the entry and exit, about the track of the projectile.
Yes.
Okay.
We pick up the bullet and pack it findings of the bullet.
Yes, sir.
Where did you get the report?
From FSL only we got that report, sir. We have sent the projectile that we recovered from the body, as well as the police which they seized those cartridges and weapons. Altogether, that report we got it from FSL. You are done.
Related to your case.
Yes, sir.
The manner of death you concluded based on?
Based on other multiple injuries which were found on the thighs and legs, sir. Based on, and also the site of entry wound. Usually in suicidal cases, it won't be used on the frontal region. The preferred sites will be over the temple region or under the chin also. Based on the site, one thing, and also after the yes, sir. And we have sent those swabs also.
You didn't mention that.
That yes, sir.
Read that.
We did that, sir. In that, on the hands, gunshot residue was not present, sir. So based on that, we concluded.
Nice.
Unattended and untamed technique.
I am Dr. Ankur, greetings from Department of Forensic Medicine and Toxicology, Kastuba Medical College, Manipal. What we observe is not nature itself, but the nature exposed to our method of questioning. The determination of circumstances and manner of death is usually straightforward, but in certain cases it becomes a bit tricky and also it ignites a curiosity in our mind as to how the event would have happened. In that context, I will be talking about my topic today, that is psychological autopsy, which is a scientific modality for retrospective reconstruction of mental state of a deceased prior to death. Developed during 1950s and 1960s by Edwin Shipman and Farlow to assess the death that appeared to be ambiguous and uncertain as to their cause and manner. Basic questions that we answer in it are: what actually happened, why did it happen, from what did it happen, and how has the subject died. And we are trying to set up the following constructs like precedents and stressors, motivation behind the act, lethality of the act, and intentionality of the act. Now, in our setting, here are few cases in which we try to use some of the principles of psychological autopsy in a limited extent to give good reads to law enforcement agencies. The first case being the hanging of a mother and 1.5-year-old child, in which you can see the image, the child and mother are there. So in this case, the family was alleging a revenge murder since the husband was absconding for another crime. So the psychological autopsy in this case helped us to identify the circumstances of death which led towards a reasoning of diabetic death. Also, we could rule out the foul play, and also we could give a kind of closure to the family that how the event unfolded, and we can rule out any kind of foul play. The second study is that of a sudden death of one of the two apparently chronically ill siblings, in which we had to see the manner of death, in which the psychological autopsy was done on the maternal aunt of the deceased. In autopsy findings, we found certain signs of physical abuse, old healed scars were present. So on psychological autopsy with maternal aunt and also with the previous hospital records of the pediatrician to whom the mother used to take both of the siblings, pointed it towards the Munchausen syndrome by proxy, and also we prevented the further adverse effect on younger sibling by informing it to police agencies, and the younger sibling was isolated from the mother. The next case is that of an alleged suicide of an adolescent female. Now, we were questioning about the events surrounding the alleged suicide, as we found a lot of Paris ligature injuries over the neck of the victim. Now, we found a lot of injuries over the body of the victim, which were the self-inflicted wounds. Now, in this case, we also found a faint amount of circumoral palate. Now, the father of the deceased was questioned about it, and there were a lot of inconsistencies in his account of the more than 60 old hesitation cuts over the hand and over the legs. And in this particular case, we gave the lead to police, and later on, the mother confessed to have killed the daughter. In the next case is that of a suspicious hanging of an adolescent male. Now, in this particular case, we saw a lot of peri-ligature marks on the body, which was going towards the foul play. But when we did the crime scene visit and when we talked to the patient family and his friends, we could establish the manner of death, and we could also establish the psychology of the deceased by looking at the kind of books that he is reading recently and also the kind of notes that he is making to self. This case was again given as a suicide. Now, the last case is that of a partially skeletonized female body. The doubt here was the unusual location of the body. The body was found near a pond. Now, the crime scene visit, our psychological autopsy with the relatives, with the neighbors, which proved that there was a pond, and based on the seasonality of the pond and the rainfall pattern, we could establish that the water receded. There was a lot of rainfall 5 days ago, and water receded, which led to the exposure of the body, and we ruled out mostly towards there was no foul play involved in this particular case. So, what do these cases demonstrate? Now, crime scene visits are helpful in performing psychological autopsies when the cases are relatively fresh. Also, it helps us to give some kind of closure to the immediate family members about how the incident could have happened. Also, flexibility is required as case per case. We have to show some kind of flexibility, and we have to be very good at promptness when we are doing any kind of psychological autopsy, since all cases are unique in their own ways. Now, apart from our studies, apart from what we did, there are a lot of Indian scenarios in which we see mention of psychological autopsies. For example, like Chandigarh study was done in 101 suicide cases. The findings of which shows the prevalence of pesticide being a causative agent in suicide of a lot of non-farming individuals, which led to the regulation of sale of pesticide, and also it led to the awareness of the suicide attempts and awareness regarding the mental health in the susceptible population, which was mostly the daily wage migrant workers. Another study was, in this particular case, a senior was accused to have abetment of suicide of the junior employee, but later on the state of High Court of Gujarat quashed the abetment charges based on the previous past mental illness history of the junior employee and also accounts of the other sides of the disease. Now, another very well-known case was Burari death case, in which the 11 diseases were studied over time, and it showed us the importance of misguided belief, also behavioral conditioning, and also the ritual killing. Another one was Section 6, 12.26a, which shows the fragmented components of psychological autopsy in our BSA. Now, Shipman has given these 16 categories, which tell us the basic premises around which we should do psychological autopsy. It includes victim history, family history, changes before death, mood changes before 12 months, and the 16th component, as you see, he has kept it open to the interpretation of the person who is performing the psychological autopsy. Now, there are few limitations in the psychological autopsy. The level of acceptability in Indian courts is still very vague about it, since there is no uniformity. In it. Now, predominance of qualitative data discourages the formation of uniform protocol. There are many international best practices about it. Cuba is leading and is doing very good in this field. So, over the period of 70 years, psychological autopsy has evolved as a scientific discipline to assist the experts to get an insight into the circumstances around the death. But with a lot of inherent limitations, there is a need to find a balance between uniform model and flexibility, allowing for adjustment of uniqueness in every case, as every case is unique, and also ensuring that ethical principles are followed along the way. These are my references. A very thank you to all of you.
Throughout your presentation, you were telling that based on the psychological autopsy, you gave a closure to the case. Multiple times you have used that. And in your conclusion, you are saying that it is only a piece of evidence, a corroborative evidence, not a scientific one. How do you justify it?
Sir, yes, the closure part we gave to family answer. It is not closure in sense of legal sense, but in the sense of psychological sense. At least they get to know, okay, what is the dieting test, how it happens, and all that. So closure to the family members, but yes, we are just a part of a long chain of evidences. So that part we will need to do. That is.
Are you legally, is it valid to interact with the family about the manner and all that? Do you interact with the police or with the family? You are saying that you gave closure to the family.
Sir,
that it is no foul play there. Are you supposed to do that, or is it the responsibility of the police?
No, sir, we didn't give closure that it is no fault or something, but we educated them about something known as dieting death and something known as those things.
Your institute, whether it is done for all the cases?
Yes. Out of that, almost in any case, if we find anything suspicious, things, still now there is no fixed uniform protocol for it even in our institute. So, but yes, in any case we suspect even a bit of foul play or something. Like in one case we found, first year PG found a little bit of circumodal error. So we proceeded with it and we interrogated father about it. So it is not fixed that in all these cases, but yes, whenever we suspect any foul play, we try to collect all the hospital records. We try to talk to police about it. We try to talk about the attendants about it. So that is how we do it. And if police is calling for crime scene, in those cases, we try to.
On the toxic cases or wherever needed, does it is helping or it is making more confusion?
So that we have, if we start doing it for every case, it becomes again hectic for us, and again it becomes very difficult to do. But yes, I feel we should start doing it at every institute, at least case to case basis we should see, so that gradually we can develop it, gradually we can also develop some kind of protocol regarding it. So since I've started presenting this first time in my institute, after that we have also been exposed to, okay, these are the lines in which we should ask the questions about. So yes, a general awareness should be spread about these things. These are the points which you can ask questions to. But yes, it is very logistically difficult to implement it for every case.
I would like to remind all the parties also, sir, from Department of Anthropology, Hyderabad, regarding the topic of single-use plastics in forensic medicine, an exploratory study of mortuaries in AP and Telangana.
I'm the doctoral student of Department of Anthropology, University of Hyderabad, and also a research assistant at after the single-use project. The bottom line are the collaborators who are associated with us in this project, and it was funded by Welcome Trust. Today, about the project, to introduce about the project, after the single-use is a whole global cooperative of around 4 continents that promises to develop a new field of critical humanities and social science research on medical plastics and circular healthcare departments. And the researchers part of in this are from India, Norway, and other 8 countries. And there are 2 collaborators along with us, the Norwegian BioArt Arena and the International Global Healthcare Program. So, as a part of this study, we examined the use and the circulation of single-use plastics in healthcare in the Indian context from India that we are using it, and situating the analysis within the broader conceptual framework of marginality and social material journeys of plastic. So, a study says that a hospital uses 531 grams of plastic consumables per day per patient, which is around 1.5 kilograms of carbon emissions per day. So, my study started from the mortuaries. Mortuaries represent one such institutional setting where marginalized workers are directly engaged in handling materials that are often overlooked in discussions of biomedical waste and plastic uses. And we are grateful to Dr. Anand Umpesh from Ongole Medical College, who helped us to look at the forensic departments also. We were started with the healthcare in hospitals and then diagnostic centers. And then we were hoped by them to look at, there is a possibility of looking at the forensic setup also. So he facilitated us to visit the Ongole Medical College, and then with his contacts, thankful to Dr. Sudha as well, who allowed us to visit the Usmania Usmania Medical Hospital. So I did my, so to introduce single-use plastics as ubiquitous in clinical settings, at their environmental footprint and procedural impact within forensic pathology remain underexplored. In forensic autopsies, reliance on plastic is driven by biohazard containment and evidence preservation, often at the expense of sustainable alternatives. This involves a detailed examination of workflow from the initial reception of the cadavers to post-mortem examination and evidence handling to quantify plastic consumption and to identify the critical junctures for intervention. This research will also assess current waste management practices in mortuaries within Andhra Pradesh and Telangana, providing insights into the disposal of contaminated single-use plastics and the feasibility of implementing more sustainable protocols. And the objective of this study is through the lens of anthropology of plastics. This study aims to map the extent of single-use plastics uses through the forensic autopsy process and identify potential alternatives or best practices to mitigate their environmental impact. There is a study by Kanishka and Bhargava in India. This and they say that a comprehensive analysis of life cycle plastics and handling of evidence and biohazardous materials within mortuaries, particularly the uses of plastics. So the methodology that we adopted, a formative study was conducted at the Government Medical College, Ongole, and Usmania Medical College, Hyderabad. Data collection involved direct observation, informal discussions with mortuary staff, and exploratory interviews with forensic medicine faculty. And then a purposive and snowball sampling techniques were employed to identify informants. Faculty participated in pre-listing tasks to catalog the plastic items used, the procedures performed, and their disposal methods. Subsequently, quantitative data on the volume and the types of single-use plastics consumed per autopsy, along with qualitative insights into current waste segregation and disposal strategies, were systematically documented. So, based on the initial fieldwork, the results were like initial fieldworks revealed that single-use plastic permeated every stage of the autopsy workflow. Major items include leak-proof body bags, waste scale sheets, and X-ray films, and then plastic vials or slabs for sample collection, and then the PPE kits like aprons, face shields, and shoe covers generate significant waste in this. Uses varies depending on the body condition. decomposed remains require extensive plastic wrapping, and in Tier 2 cities, body wrapping is further influenced by the religious customs. Based on from which religion they are coming from, the practices are different. So critically, the forensic practitioners noted that certain plastic containers may compromise toxicological accuracy, suggesting a need to reevaluate the materials. And then coming back to the discussion, the findings reveal significant quantities of diverse single-use plastic items such as gloves, specimen bags, and trays are routinely employed during post-mortem examinations, underscoring the pervasive integration of these materials into current forensic protocols. The reliance on these plastics is primarily attributed to their roles in maintaining the sterility, preventing cross contamination, and ensuring the integrity of the forensic medicine. This was spoken in the Prahalad and White work in 2022. However, this prevalent practice contributes to substantial plastic waste in marshes, posing considerable challenges for environmental sustainability and waste management. Given the biohazardous nature of many discarded items, this issue is further compounded by the specific challenges associated with disposing of human remains, which is improperly managed can lead to severe ethical, legal, and public health ramifications. And it was mentioned in the Batu's work in 2024 as well. And these are the few images that I collected from the field. I think my presentation is trying to poke the forensic fraternity to look at how much plastic that we are consuming in our practice as well. So the mask, the apron, and head cap, these are also plastic which are made of PP, and plastic covering sheets, containers, and then different types of body bags are present. These are the images taken from our own board, and these are also different types of body bags. This is the mortuary that the amount of plastic that you can see in that, like, most of them are PP and PET plastic were used for breaking and so to conclude, forensic autopsies are plastic intensive. While essential for hygiene, the heavy reliance on single-use plastic poses ecological challenges and potential risks to forensic integrity. Initial findings justify targeted trials of validated, reusable, or biodegradable alternatives. Revised procurement practices, staff training, and standardized waste management protocols adapted to medical legal settings. This is the exploratory work, and this serves as a foundation for more in-depth ethnographic research. So, these are the references that I referred to. Thank you. To know more about us, you can scan this.
Presentation, a new topic, so we should all think about. So, like now, I can tell about the AIMS Patna as I am from that. So we started using the paper envelope and also the biodegradable body bag. Also, you could have included the recommendations or the solutions to it also to your presentation. Okay, so
this is just an exploratory study, and we are.
So, can I have the funding of your project?
The funding, it is funded by Welcome Trust. Totally, it is around 65 crores. And for India, we are around 5 crores per.
So, how are you utilizing that fund? In what way?
Sir, as it is a 5-year project, there are 2 research assistants in this, and one post-doctoral researcher.
Okay.
And we used to present papers at the international conferences as well, and they are completely funded by our project. And regularly we used to have theories and methods workshops as well.
Remuneration to the assistants. Any analysis or any technical aspect, are you using your fund?
We are from anthropology, we are we are required to do an ethnographic research which requires around at least 1 year of fieldwork in the setup. So to understand the nuances of how the people deal with the situation. So the most of the amount we go to the fieldwork, and then while publishing, we used to use that publication.
Plastics. Did you observe anything about that? Because all the permitted plastics are single-use plastic.
Yes.
It should be controlled at the manufacturing itself, but they are permitting to manufacture those things. So what is the implication of that? Are those, whatever they are using in the mortuary, they are permitted or the thickness is permitted, or I think few of the things which you have shown are biodegradable.
Yes, sir, but
are they biodegradable?
No,
No, sir, they are not biodegradable and it will take around.
Those?
These are also plastic materials. They are made of polypropylene. It takes around 500 years to biodegrade.
And the container you showed in one image, does it fall under single use? You showed in one slide the container.
Yes, sir. This is also
This one is single use.
They are not using that again.
They are not using it again, but it can be used in any other thing.
No, sir. But actually, when I read about the Chipmer guidelines on single-use, the autopsy practices, they suggested once the container is used, it should be disposed along with the material. So maybe they are not going to.
Whatever I am seeing, and they are manufacturing it so that it is biodegradable, and there is a thickness guidelines also. So you should have mentioned regarding those things.
A good presentation, because it's very rare to see presentations in plastics, day-to-day use of plastics. One thing is, regarding in your research, do you focus on anything related to health effects?
Possibility of looking at occupational health as well in this project. So initially we are focusing on quantifying the amount of plastic that is being generated in these forensic settings. So probably we might look into that as well.
Because recent research says that microplastics have already entered our human bodies.
Yes.
So anything related to that, or it is entirely different scenario?
It is entirely different, sir. The practitioners who are being present in the mortuary setup for a longer duration to do the autopsies, what is the impact of that entire conditions? I mean, the space giving back to them, like, what is the health conditions that are being getting from that? When I spoke with Anand, sir, he told an example that there is a possibility of getting TB chances while they are practicing in the autopsy space. So more in-depth research is required in this. So definitely.
I would now like to call upon the fourth participant, Dr. Major Karunya Kalangi ma'am from RIMS Hyderabad, regarding the topic of challenges in determining the cause of death beyond negative and obscure autopsies.
Good morning, respected judges, delegates. I'm Dr. Major Karunya. I'm third year postgraduate from RIMS Hyderabad. Today my topic is challenges in determining the cause of death beyond negative and obscure autopsies. Introduction. We all know that establishing the cause of death is the fundamental objective of our medical legal autopsy. While negative and obscure autopsies are well recognized, there is a subset of cases that do not strictly fall under these classifications and yet present with an undetermined cause of death and are often under-recognized despite their increasing occurrence. Despite thorough medical legal investigation including autopsy, pathological, microbiological, biochemical and toxicological analysis, sometimes no definitive cause of death is identified. Observational findings, absence of significant antecedent history. Sometimes we know that no matter how much history we try to take from the patient, deceased or their relatives, we lack some meaningful past medical and surgical history. And also, even the history we get might be trivial or unrelated to death. Trivial precipitating events. Deaths are frequently preceded by minor altercations or arguments, mild physical or emotional stress. These events are not sufficient to cause death in the ordinary course of nature. Minimal or insignificant injuries. Sometimes the external injuries that we find might be very minor, and even when we do an internal examination, it might not reveal any fatal trauma. Negative toxicological findings. We come across in our practice that many times the FSL reports might be negative, or even if there is a drug or alcohol, the levels might not be fatal. Absence of significant pathological findings. No organs show acute or chronic disease sufficient to cause death, or there might not be any structural abnormalities to explain the sudden death. I'd like to recall our memories by defining negative autopsy and obscure autopsy. Negative autopsy is when gross and micrological examination, toxicological analysis, and laboratory investigations fail to reveal a cause of death. The autopsy is considered to be negative. And obscure autopsy are those which do not show a definitive cause of death, in which there are minimal or indefinite obscure findings, or sometimes even no positive findings at all. So what are the challenges that we are facing? In many such cases, no viscera is preserved and poisoning is not suspected. Histopathological examination may not reveal any abnormalities. Even detailed examination sometimes remains inconclusive. So these cases fall under the category of negative or obscure autopsy, where no definite cause of death can be established. The possible mechanisms of death might be cardiac arrhythmias with no structural defects, coronary artery spasm, reflex vagal inhibition, laryngeal spasm, epileptic events, bronchial asthma related to sudden death, dry drowning, and suspended animation. Current forensic practices and limitations. In the absence of foul play, it is often observed that a probable cause of death is assigned. Commonly attributed causes include coronary insufficiency, arrhythmia, bronchial asthma. These conclusions may not always be scientifically substantiated. There is a risk of over-attribution without confirmatory evidence. Like for example, if there is minor coronary narrowing, they might give as a coronary insufficiency or any cardiovascular disease. Lung adhesions might sometimes be attributed to TB without confirmation. What is the medical legal dilemma that we're facing? The key issue arises, if no foul play is evident, how should the cause of death be certified? Is it acceptable to assign a probable cause without definitive evidence, or should the case be labeled as undetermined? This creates confusion among forensic practitioners regarding classification of manner of death, legal implications, ethical responsibility, certification. So the discussion is, these cases highlight that there are limitations to our conventional autopsy in detecting physiological and transient causes of death. The absence of morphological findings do not exclude fatal physiological disturbances, which might be difficult to prove to give as evidence. And there is a need for advanced investigations like molecular autopsy and genetic testing. Like in the Western countries, there are certain genes that can be tested. Suppose there's some, yesterday also there was a presentation. There is something called sudden death in epileptic conditions. So that gene can be detected through genetic detection. And also some people might be more arrhythmogenic, cardiac arrhythmogenic. So those genes also can be detected. Standardized guidelines for handling such autopsy cases can be. The conclusion is sudden unexpected deaths in young individuals represent a significant and growing forensic challenge, especially in the absence of definitive and accurate findings and when there is no evidence of foul play. Circumstances suggestive of natural death with the exact cause of death remain uncertain. Why can't these deaths be classified as no foul play seen, probable, unknown, natural death? These are my references, sir. Thank you.
It's tends to be classified as no foul play seen. In the courtroom, how can you establish the foul play? How can you prove that you can tell with certainty that no foul play can be seen?
The FSL report is negative, or if there's any finding in the FSL or pathological findings, so those can lead to telling us if there is foul play.
The terminology foul play in a legal way cannot be justified in the court. That is my perspective, because you have to establish a foul play by displaying some evidence. If there is lack of evidence, you cannot put the term foul play there. That is an active term legally. So I think there you might encounter certain problems regarding that words, because lawyers are particular with that words.
In your presentation with challenges,
Yes, sir.
you concluded in sudden and unexpected death.
So
How are you connecting all these things?
obscure autopsy. So if we can't categorize these
You
deaths,
are mixing both the terms, negative and obscure. We cannot go into the details of that.
sir.
But there is a lot of difference between negative autopsy and obscure autopsy.
Yes, sir.
So I think there is a proper conclusion.
Last year is that a new, first time we are seeing the term probable unknown natural death. It could be true also, but to tell that in court of law that no foul play seen, because investigation is not our part. just as scientific professionals where we interpret injuries to human bodies and guide the judiciary regarding this could be the probable reason. Any good attempt? Thanks.
Just one thing I have to add. In medical legal, there is no role for the word probable.
My attempt was
Other than obscure and necrotoxy, there could be some other reason in human body, which might say, for example, narrowing of the coronaries might be to cardiac insufficiency and then death could have happened, which cannot be determined by postmortem examination. Is that your point?
yes, sir. Because literature says more than 75%, then only it leads to the coronary spasm. So sometimes it might not be 75%. So how are we able to determine that exactly? And
Yeah, that's the exact reason. That's the reason the terminology obscure and negative order.
yes,
Well done.
thank you.
So whatever like we are writing the PM report, so what is being seen, if there is a like negative findings or you are told FSL report is negative, but that doesn't mean that it is negative. If you clearly see that they are mentioning not detected.
Yes, sir.
Okay, so there are many reasons of negative, even for histopathology also. Most of the reports which I have seen partially autolyzed or completely autolyzed. So there are many reasons. So what like I want to say that if nothing is been seen, you can clearly write cause of death couldn't ascertain, you couldn't determine. If you like you have told genetic testing we can do. So either do it, prove it, and then mention that particular disease. Otherwise, right, cause of death couldn't be ascertained. I don't think so. Like this, like no foul play seen or probable unknown natural death. Because there is also the Ewing postulates trauma and disease. The person who knows like inherited disease, so they can trigger that, and that because of the gene that can lead to the heart attack. So there are many scenarios are there. So you should write what is being seen or which you can prove it in the PM report as possible. So, thank you.
Thank you.
Medical College, postgraduate student, and the second presenting a case of adrenal with dog bites. Introduction: dog bites are a major public health problem, especially in India. Ranges from minor superficial to severe life-threatening injuries. 2.2 million dog bite cases, 48 deaths to the dog bite incidents have been noted in 2025. This is mentioned in and the babies-related deaths to the dog bite account for thousands annually in India. Approximately 5 to 20%. However, death due to the dog bites have been on the rise. The same has been discussed in the presentation. The 4 fatal dog cases in urban Bengaluru autopsy at our centers between August 2024 to July 2025 are being presented here. Case number 1. The elderly female aged 70 years has gone for morning walking near the airport and attacked by a pack of stray dogs. The injuries are mimicking like a stab wound or incised wound. And our spark has been noted here, and the laceration has been, and the dog bite mark pattern has been present over the right sock. And this is also the same disease image, and using the first lacerations and waist aberrations have been noted in the back of chest and both the lower limbs. So what's the laceration of the skull? It has been documented in the CCTV footage of this woman has been much better. Stray dogs of 6 to 7 dogs. The sternocleidomastoid muscle has been pulled out. And the exact teeth pattern has been noted in that. That's it. And Kevin has been the opinion, the cause of death is encouraging and hemorrhage and shock as a result of multiple injuries sustained, consisting with the animal. Case number 2, the 40-year-old male, known alcoholic, missing after visiting the bar operated on around 11:30 p.m. around body form next to the empty site area. Multiple dog bites has been noted. Here is the case. Again, the hours question. The dog bite pattern has been marked out. And again, the cause of death is the present shock and hemorrhages as a result of multiple research with the animal bite. The case number 3, it was on 23rd of February, from 2 years old male to the bar in the temple was implanted around 11th PM, confirmed with CT footage on next day. Body was found naked in the prone position. The period approximately 100 meters from the bar, the multiple injury has been presented and 2 stray dogs were found near the body. Here is the images of the disease. Again, the dog bite mark has been the death is due to electric shock as unforeseen of an autopsy findings and the forensic science laboratory report. I am of the opinion that death is due to shock and hemorrhage as a result of multiple injuries sustained, consisting of animal bite mark. However, the disease has consumed all prior to his death. Yes. Case number 4. The 68 years old elderly male, painted by a professional, was suffering from the asthma, was missing since 10:30 PM. At 7:25 was found dead 100 meters away from his residence, multiple injury on his body. He is the principal of the engineering college. He went to feed the dogs on the street with the night around 10:30 PM near his residence, and he was found dead in the morning. And his position was, and it is grazed aberration, and hours respiration has been noted. The both upper limb and lower limb to be resisting and protecting in the place. The death is due to shock and hemorrhages, as a result of multiple session transmitted from the animal body. Now, we will discuss multiple laceration and puncture wounds, bone and tender exposure, and extensive tissues awards and sharp survival infection. It's a puncture wound, deep penetrating wound, laceration, and healing and crushing wounds, and our severe tissue was unrelated. Forensic importance, wide pattern analysis should be done, and the cause and manner of death should be assessed, and legal liability should be noted. And types of the injuries, like puncture and laceration, crush and hours should be made. The deep narrow wounds and repeated injuries and irregular tears of the pattern of fatal attacks in our cases has been closely monitored, and as I noticed that it was in the early morning and the late night has been these 4 days open, and the victims are alone, and injuries appearing on hours exposed to the bone consisting of two lesions. Injury commonly due to the bite where the arch pattern bite marks, and fatality occurs rapidly due to the hemorrhage shock rather than the attack behavior is identified as the primary cause of fatal attack. The contributing factors of this fatal attack has been noted like poor urban planning and improper waste disposal in the case of cobra and liquid water. The bite, dog bite injuries shows a distinct pattern based on the victim age and the region. Injuries arise from superficial abrasions and deep lacerations, hours and tissues. So multiple injury of a wicked back attacks rather than the single dog on presence of puncture wound and bleeding infection with infection, venom depletion and dog bite process. The pattern recognition of the conclusion of the cases. The pattern recognition is crucial for forensic interpretation and differentiation from other forms. Increasing incidence arising due to the public health measures and stray dog control program. Supreme Court has been zero references, and Supreme Court has been mentioned the 5 takeaways from the body of stray dogs is only the listed areas, not only streets. Notice code to be placed where the feeding zone. The feeding dogs on streets are legal action. The Supreme Court seeks the national book, stray dogs measuring, and the official obstructing an official to the some 25,000 fine. Thank you. The cause of that is the shock and hemorrhages. They have like noticed that these many cases have been like is admitted in our hospital itself.
So your final opinion regarding the cause of death will be?
Very crucial that a lot of bleeding in the same spot.
Usually, objectives of autopsy itself, they say animal attack is included in the autopsy, right? So, due to some animal attack, you can establish that because that will be a mechanism you are primarily focusing on the mechanism, right? So that might lead to some sort of confusion, because in many other cases also you will see hemorrhage and shock. That is a common mechanism involved in even RTA also. So you have to shift the focus from that to the COD, leading to ankle attacks. And certain
it is absolutely wrong. Whatever it is, you should mask the identity. It is very important. People who are sitting in the audience will identify the business. Okay? Not appropriate. Whether you are publishing or presenting anywhere, you should not reveal the identity. Will you be able to identify the animal from the lights? Your title was the pattern of injury from dog bite. You concluded that it is only because of some animal bite. Will you be able to identify that it is because of cat or dog or any other specific animal?
No. The arch and the pains, the marking has been noticed. The whole pain marking has been noticed. And this is
any veterinary
writing in the cause of that animal bite, so you should prove it. Okay, you have proved you have taken the expertise. So whether you show the dental casting being done, you have taken expertise. So you mention in the PPT. You present it in that. So you got a LS history of dog bite. Okay. So and you are proving it in cause of death also. You are writing animal bite. But how you have come to that conclusion? Animal can be snake also, or cat, or any animal. So, but you are focused, like your title is also on the dog bite. You should focus in that only, and you should give opinion that with a proof. Then only it will be like line. Okay, got it.
Sir, all of that is done, sir. Like in cases, there is an arm of blood, sir. Like for example, it is on veterinary doctor has been confirmed. And one case has been in particular is
Was specimen sense for examination?
Yes, sir.
What examination was done?
Weight injury marks.
Now, routinely, what you do in your institute for naked bodies demonstration, that is being done or not? No.
Exploration of drowning with postmortem aquatic renal artifacts. As per WHO, drowning is defined as a process resulting in primary respiratory impairment due to submersion or immersion in liquid medium irrespective of outcome. It is a form of mechanical asphyxia where air entry into the lungs is prevented by fluid, leading to hypoxia and death. It remains a significant cause of accidental death in individuals, especially in rural aquatic environments. Pathophysiology of drowning. Voluntary breath holding leading to panic and immoral inspiration and aspiration of water into abyss, leading to surfactant washout, which leads to alveolar collapse and formation of proteinaceous fetal froth, which leads to ventilation perfusion mismatch, leading to hypoxemia and cerebral hypoxia, and loss of consciousness leading to cardiac arrest. Types of drowning. Drowning can be broadly classified into several types based on pathophysiology. Wet drowning, dry drowning, immersion syndrome, secondary drowning, obligate drowning, and near drowning. Case report: an 18-year-old male student reportedly went swimming in a village tank and developed fatigue leading to submersion. The body was recovered after approximately 24 hours. Autopsy was conducted the following day with an estimated postmortem interval of 2 to 3 days. Police inquest revealed no evidence of foul play suggesting accidental drowning. Autopsy findings: external examination. Body showed early decomposition changes, including cutaneous marking. Fine blood-tinged clot was present at the mouth and nostrils, a key indicator of drowning. Wasserman changes were noted on extremities, indicating prolonged immersion. Animal bite marks over the ear were consistent with postmortem aquatic scavenging. No external injuries were observed. These are the pictures showing external findings. Internal examination. The lungs were voluminous and bulging, overlapping the heart. On sectioning, they exuded blood-tinged salty fluid, characteristic of emphysema aquosum. The heart and brain were unremarkable. The stomach contained partially digested particles without any abnormal odor. Viscera were preserved for clinical analysis and samples were retained for dietary testing. Pictures of internal examination.
Discussion. Diagnosis of drowning is always multifactorial, requiring correlation of history, autopsy findings, and laboratory investigations. In this case, the presence of fine persistent clot, emphysema unperson, and emotion changes strongly support antemortem drowning. Differential diagnoses include postmortem immersion, cardiac death involved, and poisoning due to submersion. Hence, toxicological analysis is always essential. The diatom test serves as supportive evidence, as diatoms may enter the circulation and deposit in distant organs. However, it has limitations including false positive and negatives. Diatom test reliability and controversy. Recent systematic reviews highlight that the diatom test remains widely used but controversial. Modern studies emphasize that diatom should be considered supportive evidence, not definitive proof of drowning. Interpretation depends on organ distribution, quantity and species matching, correlation with water source. Major limitations are contamination during sampling or laboratory processing and false positives. Items being present in the non-drowning cases also. Lack of standardized protocols. A 2025 to 26 review concluded the evidentiary value of diatom testing remains elusive and contentious and must always be interpreted along with autopsy and field findings. Advances in diatom detection techniques. Recent studies have introduced modern technological approaches to improve accuracy, like DNA metabarcoding for species identification, automated detection using artificial intelligence and deep learning, improved microscopic and chemical extraction methods. These advances aim to reduce observer bias, increase sensitivity and specificity, standardize identification. AI-based models are now being developed to automatically classify items, improve drowning versus post-mortem immersion differentiation. Emerging biomarkers in drowning diagnosis. Recent studies are exploring biochemical markers such as surfactant proteins, SPKMD, NT-proBNP, and D-dimer. These may help confirm drowning, differentiate from other causes of death. However, these are still under research and not standardly practiced. Key takeaways from recent lecture. Modern forensic research strongly agrees that no single test, including item test diagnostic, drowning diagnosis must always be multidisciplinary. New technologies like AI, molecular methods are promising. Standardization of protocols is urgently needed. Conclusion. The present case demonstrates classical features of antemortem drowning, including fine persistent clot, emphysema unperson, and immersion changes. The absence of injuries or evidence of foul play supports an accidental manner of death. Based on the available history, autopsy findings, and supporting evidence, the cause of death is consistent with drowning. Pending confirmation by chemical analysis, this case highlights the importance of a multidisciplinary approach to forensic diagnosis of drowning. From a medical legal perspective, establishing drowning helps differentiate between accidental, suicidal, and homicidal deaths and detect body disposal cases. Preventive measures include public education on water safety, supervised swimming, avoidance of alcohol consumption near water bodies, and implementation of safety infrastructures, such as warning signs. These are my references.
First slide there, written medical legal exploration of drowning with postmortem aquatic animal artifacts. In the discussion part, there is no word regarding artifacts. Not the conclusion, last conclusion slide. Because the last conclusion part says only drowning, not about any artifacts. Because the heading is drowning with postmortem aquatic animal artifacts. In the conclusion part, there is no mention of aquatic animal artifacts. Mask identification.
In this way also, how you can mask it and do the reverse. Okay. But you have to always mask the identity. Okay. Got it? Secondly, kindly justify your title. You have put silent death. What does it mean? Like silent death is okay. Silent deaths. Deaths are silent. What else you want to say with?
In front of reference, apply submerged due to fatigue. So, in the distance of about 10 kilometers from around.
Okay. So, make the title as per your presentation or you justify in presentation. Okay.
Since you have told the history that with a group of friends
that person had accidentally died. We can't, because of absence of injuries or evidence of foul play, it does support only accidental manner. It can be suicide also.
I'm Human first year plus graduate from SS of Medical College, and I'm presenting a case of homicide suspected homicide. My name is defined as a form of physical concentrate on the body using a literature of the rather than process rate of the body. Finding is one of the most common methods of usage in medical legal practice. Presence of ligature must over the neck often leads to insignificant small suicidal activity. However, all ligature must are not indicated of suicide. Smoking is a form of mechanical asphyxia caused by forceful obstruction of external passages, especially the nose and mouth by a hand, full of blood caused by a single object. In certain cases, homicide breaker dangers, suicidal hangings, to receive justice, a malicious intention of the group related to legitimate medical legal problems. Such cases require careful scene evaluation, detailed without examination, correlation with circumstantial evidence. This case emphasizes the importance of forensic distinction between suicide and shared homicide. Case 16. A 27-year-old male was brought to the mortuary with alleged history of suicidal hanging. According to police inquest, body found hanging in the bedroom. No immediate signs of disturbance reported. Further inquiry reveals ongoing marital conflict with frequent quarrels related to past relationship. The wife had advised the police complaint on initial appearance favored suicide to be malicious. Action taken, medical legal autopsy conducted to ascertain cause of death, mode of death, and manner of death. Examination findings: injuries, control of cells 2.5 centimeters into 0.5 centimeters into and 2 centimeters into 0.5 centimeters noted on outer upper lip and inner aspect of lower lip in the midline, respectively, with superficie of teeth noted fluid color. Severity of laceration of size 0.5 centimeters into 0.5 centimeters into upper lip, noted on inner aspect of lower lip, left side with irregular frontal margins. Severity of scratch abrasions of third size 1 centimeter noted over foot of nose on the left side 0.5 centimeters apart, red in color, fracture dislocation of novel bone, with bleeding of lateral side and into paralysis is noted. Contusion of size 1 centimeter to 0.5 centimeters, noted just below the iris over back of the neck, left side blue in color. Contusion of size 4 centimeter into 1 centimeter, oblique length over back of left forearm side bluish in color. Multiple linear scratch marks noted over an area 3 centimeters to 2 centimeters of varying length, 0.5 to 1 centimeter noted over lateral aspects of right arm. Contusion of size 6 centimeters to 2 centimeters, oblique length over back of lower umbilical cut of abdomen and left side bluish black in color. An object is placed to continuous postmortem pressure of gel noted over the neck and level of thyroid cartilage. The ligature mark is measuring 31 centimeters in length and varying width of 1.5 to 2 centimeters. The ligature mark is pale brown in color with no pulsation and perception measured to this effect. Internal findings: there was no evidence of confusion of areas and the regular structures of neck. White color frock with particles is seen in trachea and bronchi. Absence of classical hanging signs like no elongation or stretching of neck structures or typical internal features of neck. And chemical analysis of liver or poisoning is negative. Discussion: this case initially appeared as suicidal hanging, but findings contraindicated. Key contraindications include ligature mark alone is not conclusive and characteristic information typical hanging. There was no evidence of confusion or hemorrhagic areas on the inner structures of neck, as it could be concluded as postmortem ligature mark. Presence of multiple prismatic abrasions, lip contusions, and nasal bone fractures indicates smoking. Injuries indicating struggle before the death, encouraging the person not to resist to facilitate smoking. For the interpretation, findings include assault before the death, mechanism, smothering followed by postmortem suspension of the body to mimic suicidal hanging. Conclusion: cause of death is smothering, mode of death is asphyxia, and manner of death is homicide. Ligature mark was due to postmortem prescription with fixal not to mislead the investigation. The forensic indicators of homicide: multiple physical abrasions, lip contusion, and nasal bone fracture, going towards smothering. Defensive injuries are present. All sorts of classical hanging features. Overall evidence strongly support homicide behavior as suicide. My references. Thank you for giving me this opportunity.
Do you practice writing manner of death in your college, in your postmortem report?
No, sir, we will not mention.
You have mentioned that you had given it is homicides. You have told fourth point, there was no evidence of contusion or hemorrhagic areas under the inner structures of neck. Do you expect hemorrhage and contusion in a regular hanging case? What are the findings below the ligate mark? Can you explain?
In case of antemortem finding, there will be marked confusion and hemorrhagic areas on the mark. But as this was post-mortem, there is system.
What is the injury on the left side photo? Right side there is one photo.
Yes, unveiling the person not smothering while struggling with that.
So is it an antemortem injury or a postmortem?
Antemortem.
While suspecting whether that injury was present, whether that injury was not.
While unveiling, not restricted to facilitate smothering, while unveiling process, the injury was found.
As follows, it depends on the levels of the methemoglobin levels, cyanosis, headache, loss of consciousness. So here, when it is used as a preservative, the nitrite is converted into nitrosamine when cooked at high temperature. So it is classified as group 1 carcinogen. It might cause colorectal cancer. So I would conclude by saying that suicide is a major public health concern and it is a significant challenge in India. So suicide mainly occurs by a strong reason and a weak moment. So here, what is actually the weak moment? So here the weak moment is he is a depressed Gen Z guy. So a Gen Z guy, he had committed suicide. He had a well contemplated suicide note, and he had access to a well researched suicide it was, and the suicide note says that he had researched about the methods of suicide to commit, as well as he had access to the availability of the source, as well as how to commit suicide as well. And why am I talking about suicide this vividly when it is just a simple case of suicide? Because just presenting a case, getting a prize and publishing it is over. It is just a suicide. But no, I'm not here to just present a case and get away. Because he was once part of a family, and also my aim here is not just to present a case. Here he was a part of family, and also my objective is that to prevent natural death, because the case reports that he might have accessed should have been privatized, like limited access, especially the research articles, which should have been limited, especially to common people, like how Medscape and Medscope have. So, and coming to the reason for choosing this case is that without knowing the distinctive and peculiar characteristic features of this case, it is difficult to come to a diagnosis of this case. And the medical legal importance of this case is the suicidal cases are increasing globally. Next is in the public health, it is used in the food preservation. I have correlated the following findings in my case with the reference articles that I have mentioned in the following slides. These are the reference articles. And I would like to for articles to general public.
Report of a real case, repeating the same. Try to avoid that. One. And you told real case. On what basis?
According to NCRB, if I want to be specific, it is not even reported to be specific under.
Where you have told?
I didn't even mention because.
You have to mention, no. The topic is where. Title you are telling where.
Because I wanted to.
On what basis? On what basis?
Because it's like suicide, sodium nitrite, it's very globally itself we have only 12 cases.
That means you have to tell, no?
In scientific presentations, you need to provide evidence for whatever you say in the form of reference or in the journal or something like that. How did you procure sodium nitrite How did he procure that? How did he get that? How did he get access to sodium nitrate? Where it was? Any information regarding that?
The IO has told that he had purchased it from a chemical shop, fertilizer shop.
Usually, poisoning case.
Because this might have been classified under unknown poison, sir.
No, unknown poison.
Through the NCRT report.
Which report you have gone through?
2022 is the last report, sir.
And one more thing, you are discussing about suicide, psychiatry, and other things. Have you taken effort to do a psychological autopsy in these cases, especially? Since you are saying it's a rarest of rare case, suicide, something like that. 12th objective or something. Psychological autopsy, have you tried to do in this case, rare case?
Many of the photos are distorted. You go to the second slide. Third slide. They are distorted. So you need not distort them. You can just reduce or increase the size. First. Second, you are repeating the photographs.
Presenting a case title named Justice Beyond the Grave, Autopsy Unmasking a Repeated Offenders. Homicide remained one of the most serious forms of violent death encountering in forensic practice, posing significant challenges to both medical legal experts and investigating agencies. Among its various forms, blunt force trauma, particularly involving the craniofacial regions, is the leading cause of fatal outcome due to its involvement in vital structures. Elderly individuals, especially vulnerable, which often result in severe and rapidly fatal injuries. Determination of the cause and manner of the death in homicidal case is frequently complex, and especially when circumstances are unclear and when attempts are made to mislead the investigations. In this context, forensic autopsy serves as the keystone of the medical legal evaluation and providing objective and scientific evidence regarding the nature, extent, and the timing of the injuries, as well as the mechanism of the death. In the same instance, failure to establish evidence in earlier crime may embolden offenders, leading to repeated acts until scientific examination exposes them. Detailed documentation of the both external and internal injuries not only aids in establishing the cause of death, but also plays a crucial role in differentiating accidental, homicidal, and suicidal events in reconstructing the sequence of the events. International forensic and criminological research has emphasized that repeat offenders often demonstrate behavior consistency and escalation in violence, gaining confidence when initial crimes go undetected or unpunished. Such pattern highlights the importance of meticulous forensic examination, as autopsy finding may help in linking repeated offenders and uncovering hidden patterns of crime and behavior. Autopsy has a key role in cause and manner of the death, crime reconstruction, and linking repeat offenders. Now my case is a 68-year-old woman was brought for medical legal autopsy to the SPSR Nellore district on January 5, 2026, following a report of suspicious death by her son. The disease was discovered lying in a supine position on a bed with a mosquito net, which raised concern about the assault because of multiple injuries on her face. During the initial investigation by the IO, noted that the victim has cohabited with an elderly male companion, aged 75, for approximately 40 years in a living partnership after her husband died. However, neighbors reported that for the past 2 to 3 months, the couple has been frequently arguing over financial matters. So the first suspect is that person, that elderly male only. But initial investigation, the elderly male was ruled out due to inconsistency in the injuries, according to the IO, investigating officer. Later, the IO brought the body for the mortuary post-mortem examination. Here are my examinations and findings. There are many lacerations and contusions present all over the faces. Major are the laceration of size 11 into 5 centimeters, which is bone dip present over the right forehead region, which has a depressed fracture of the frontal bone on examination, present with marked hemorrhagic infiltration. Laceration of size 1 into 0.3 centimeter, bone dip located over the right cheek, which is 1 centimeter below the right eye. Laceration of size 1 into 0.3 centimeter, which is also bone dip present over the nasal bridge, which also causes the fracture of the nasal bone. Laceration of size 1.5 centimeter, bone dip present on the central portion of the upper lip, which causes crushing with hemorrhagic infiltration. Laceration of size 2 into 0.5 centimeter, which is bone deep, present over the right side of the lower lip, underlying tissue, crushed and lacerated with fracture of underlying bone. There are many contusions are also present. Contusion of size 3 into 2 centimeters, present over the right cheek, which is 2 centimeters below the right eye. Contusion of size 4 into 3 centimeters, present over the left cheek, which is 2.5 centimeters below the left eye. Internal findings in skull is a subskull hematoma noted over the frontal region. In skull, there are fracture of frontal bone, which is extend to anterior cranial fossa. In brain findings, subdural and subarachnoid hemorrhage are noted. Face has multiple fracture on both sides of maxilla and mandible, with loosening of the teeth, with hemorrhagic infiltration present over the fracture line, and there is many teeth are missing also. Neck structure, contusion of underlying neck structure with fracture of the hyoid bone, which is inverted fracture of the greater horn of the right side. The thyroid cartilage is intact in this case. Now coming to the discussion part. Cause of death in this case is craniofacial injuries due to blunt trauma to head and neck. Blunt force injuries to the head and neck are frequent cause of homicide, particularly among the older adults. In this particular case, severe abrasions and bruises on the craniofacial area suggest considerable force was applied multiple times using a heavy blunt object, leading to serious intracranial damages. The pattern of the injuries among critical reasons supports the medical legal conclusion of deliberate homicidal violence. A hyoid bone fracture is an indication and implies neck trauma had occurred due to significant impact on compressions. On observation of the autopsy result, the crime scene detail and intact mosquito net was noted, which suggests the possibility of attack by someone familiar to the victim, as its undisturbed condition was unusual for an assault by an unknown intruder. As per the IO, there is no indication of theft. However, the autopsy revealed sign of strangulation and marks near the ears and neck part, which is after that discovering missing of gold jewelry. Additional investigation implies a motive of deliberate homicidal aggression. As the result of finding methods, the inquiry took a dramatic turn and concentrated on the missing jewelry, leading to the identification of the individual who had traded the deceased gold jewelry. During the questioning, the individual confessed to the murder and explained that the victim has discovered his affair with the daughter-in-law. So he has to convert that case from gold shift to the motive of intentional killing to the robbery and murder. Upon further examination, he admitted to previous crime that followed the same pattern 3 years ago, resulting in the death of another elderly woman. This indicates has been mistakenly classified as natural death, as the deceased woman elder son believed that his young brother has caused her death while under the influence of the alcohol due to property dispute. Later, consequently, no complaints was filed regarding the matter in that case. So he also murdered the woman because he discovered his affair with a younger son's wife. He took jewelry to mislead the investigation. Later on this basis, exhumation and conducted. In this case, the initial claim was no theft, was later proven incorrect. Additionally, connecting the case to a previously unnoticed incident through exhumation and similar injury patterns highlight the significance of forensic medicine in revealing hidden homicides and confirming patterns of repeated offenders. These are the slides from the site of exhumations. There are many cases. In this case, this is from Especial Nellore, where elderly female died due to blunt force trauma to head and neck, which is homicide suspected initially. But with forensic autopsy and along with DNA and exhumation, we have find an intruder, and with this confession, we have revealed one more case. These are some more cases which is similar to this. This is my conclusion. This case demonstrates that the accurate forensic autopsy can not only determine the cause and manner of death, but also expose repeat offenders. This underscores the critical importance of forensic autopsy surgeon, whose significant scientific evaluation and determination not only clarify the cause of death and redirection the investigation, but also uncover a previous hidden homicide, ultimately aiding into pursuit of justice across multiple cases. These are my references. Thank you. Autopsy done, sir. In that case, elder son thought that younger son in drinking state killed his mother, so they don't want that case to come out because they are having property dispute. It will claim on them, so they call it a natural death and no fault.
Same person we got in the first case.
Yeah, sir.
But outcome you are coming to an opinion that the pattern of injuries are similar.
Sir, after exhumation, sir, we have found that all skull bones are crushed in that cases. All mandible or he has in first case he has killed that woman with stone, sir, And he told that similarly, because he know that pattern, that person is definitely die, the same thing happens in second case. From second case, we have to go backward and two, sir. So repeat offenders plus 2 cases solved, sir. With repeat, he is a repeat offender, but 2 cases solved.
Okay, Mr.
Our next participant is Dr. Sabhavan Srikanth sir from Osmania Medical College with this topic of when oxygen.
My dear colleagues, I will start my presentation. It was truly a privilege for me to present this rare and visually striking case. The title fed When Oxygen Turns Lethal, a Forensic Insight. This case, the presentation mainly focuses on a fatal hydrogen peroxide ingestion. It is a forensic case report. So myself, Dr. Sabhavan Srikanth, third year postgraduate from the Department of Forensic Medicine and Toxicology, Usmania Medical College. So coming to the case history, a 30-year-old married female who was brought to the emergency department with a alleged history of ingestion of hydrogen peroxide. The exposure was suicidal in nature following domestic issues. She was presented within a few hours of ingestion and she complains of vomiting, abdominal pain and breathlessness. There was no significant past medical history and later she was declared broad dead at Usmania General Hospital and later shifted to the mortuary for conducting a medical legal autopsy to determine the exact cause of death. So coming to the external examination, the body was wrapped in a bed sheet and dressed in a black color clothing. Here in the images you can see both the eyes are closed and periorbital edema is present and the lips are discolored to bluish color due to hypoxia. And the notable finding is white color froth is oozing out from the angle of the mouth. And in postmortem changes, the rigor mortis is present all through the body and postmortem livid is present over the back of the body. In the images you can see the first image there is periorbital edema and the second image that is stannous lips. This is due to hypoxia. And the third one is the most important finding in this case, there is froth at mouth, white color froth. I will be discussing this in the later slide. And fourth slide is postmortem lividity. These are the autopsy findings which is non-significant, like non-exact findings of the poisoning case. This will be findings found in the other poisoning cases also, like congested brain and frothy fluid in trachea. This involves the respiratory involvement and another one is congested lungs. Here you can see the congested liver, congested spleen and congested kidney. And this slide is the most important slide for my case presentation. And why I said this rare case because initially when I received this case for postmortem examination, I assumed it to be a routine poisoning case. But after I had done the postmortem, when I reviewed the literature with my findings, I could not, to the best of my knowledge, I could not find any clear documentation picture for this gross finding. So coming to the presentation, on reflection of abdominal wall, about 100 ml of white color creamy frothy fluid is present in the stomach and the same amount and 50 ml of white color creamy fluid liquid is present in the peritoneal cavity. This is due to the perforation of stomach and the mucosa is congested. This white in the slide you can see the image that is whitish color creamy liquid. That is the gross finding, definitive finding of the hydrogen peroxide ingestion. And other findings, uterus is present to be was not present. That means suggestive of recent hysterectomy. And all internal organs are congested and additional observation and we didn't put for tissues for further examination. However, the specimens are preserved for chemical analysis. And before going to this slide, like for this case, the cause of death is hydrogen peroxide ingestion due to based on circumstantial evidence and the definite gross finding of white color creamy fluid. The term is known as snow white or frosty coating sign, given in the many references and other in other publications. So coming to the discussion part, hydrogen peroxide is a clear, colorless, odorless oxidizing agent. It is available in concentration ranging from 3% to 90% and the toxicity depends upon the increasing with the concentration. The 3% solution is used as mostly household disinfectant and is the most common cause of accidental poisoning, especially in children. And 35% solution is marketed falsely as health remedy in HIV, cancer, and other diseases. And more than 90% solutions is used in industrial applications such as rocket fuel. Coming to the mechanism of toxicity, hydrogen peroxide produces toxicity mainly by three mechanisms, that is caustic injury, oxygen gas formation, and lipid peroxidation. And we will go through the mechanisms. First one is caustic, that is corrosive injury. It has the hydrogen peroxide acts as a strong oxidizing agent and caustic agent. It causes burns, erosion, and ulceration of mucous membrane. The pathophysiology at the cellular level, the directly oxidation of proteins and lipids that leads to the disruption of cell membrane, and that leads to the mitochondrial dysfunction, and that will be results in the necrosis, apoptosis, and edema and inflammation. The clinical effects are on ingestion of 3% hydrogen peroxide. It causes severe mild gastritis and mucosal irritation, and severe effects are uncommon unless it is consumed in large quantity. Next one is on ingestion of 35%, it causes severe corrosion, ulceration, and even perforation. The patient may present with hematemesis, abdominal pain, and peritonitis. A characteristic feature is called hydrogen peroxide enteritis, that is immediate bubbling followed by whitening of mucosa. It is known as snow white sign and frosting coating. This is due to oxygen microbubbles in the capillaries. When it is exposure in the airway exposure, it leads to laryngospasm and subglottic stenosis. So for these cases, they may require intubation and ventilation.
Please.
A conclusion is like hydrogen peroxide acts as both mechanism as corrosive and oxygen gas formation. In my case, the main mechanism of cause of death is oxygen gas formation and corrosive injury. Thank you. Any clear drops pictures? Pictures.
But in literature.
And there is no literature about the gross finding.
Okay.
They have mentioned that it's frosting.
Oh, thank you.
Is requested to ring the bell.
Respected judges, senior faculties, all my colleagues, myself Dr. Rahul Kundagilwa, second year resident doctor from Vilasrao Deshmukh Government Medical College, Maharashtra. The topic of my today's presentation is psychotic filicide masquerading as an accidental pediatric trauma, a forensic reconstruction of a blunt force impact injury in a 17-month-old. So what is psychotic filicide? Psychotic filicide is a rare but extremely complicated phenomenon at the nexus of psychiatry and forensic medicine. Occurs when a parent suffering from a severe mental illness like psychosis was the death of their own child. Due to their inherent susceptibility, fatal injuries in children are frequently assumed as an accident, especially blood for trauma. However, certain cases may concern intentional trauma as its presentation might overlap with the accidental injuries. In this context, to differentiate between the intentional and accidental trauma, a forensic reconstruction which entails a thorough linkage of clinical history, post-mortem results, and injury biomechanics becomes crucial. My case presentation. So a 17-month-old female child was brought by her father with alleged history of assault and died during treatment at government hospital Latur. As per history, the mother and child were alone inside a locked hall. Upon repeated knocking, the husband found the door unopened for some time. When it was eventually opened, the child was lying unresponsive on the floor. The mother initially reported that someone was attempting to take the child. However, during the course of investigation and interrogation, she confessed of having killed her own child. The cases raises important concerns regarding maternal mental health, filicide, and the need for thorough forensic and psychiatric evaluation in such incidents. On external examination, head and face injuries, there were multiple abrasion and contusions over forehead, cheeks, nose, and frontoparietal region. There was a contusion of size 6 into 3.5 centimeters subcutaneous deep present over left side of forehead, reddish. All injuries were reddish, indicating recent trauma. On neck, upper limb, and trunk, there were abrasion over the submandibular region, the downside image. of size 8 centimeter into 0.5 centimeter, and neck there was another injury 1.5 centimeter into 0.5 centimeter. There were 2 crescentic abrasion on left arm. There was 1 centimeter into 0.5 centimeter subcutaneous deep abraded contusion over left wrist. There were multiple superficial incised injury on left trunk varying from 2 into 0.1 centimeter skin deep to 12 into 0.1 centimeter. There were abraded contusions over right subscapular region of size 3 into 3 centimeter subcutaneous deep reddish. There are also injuries to the external genitalia. On left labia majora, there was laceration of size 1.5 centimeter into 0.5 centimeter subcutaneous deep. Margins were infiltrated with blood. On right labia majora, there were 2 abrasions of size 0.7 centimeter into 0.2 centimeter and 0.3 centimeter into 0.2 centimeter reddish. On the vestibular area, there was laceration present of size 0.5 centimeter into 0.2 centimeter subcutaneous deep. Margins were infiltrated with the blood. On internal examination, head, skull, there was diffuse contusion present over left frontoparietal temporal region, and there was contusion present over right frontal region of size 3 to 2 centimeter reddish. There were no fractures of vault or base. On brain, there was diffuse subdural hemorrhage over left hemisphere. There was diffuse subarachnoid hemorrhage, and the brain was edematous and congested. These are all suggestive of significant blunt force head injury despite absence of skull fracture. On thorax and neck findings, the thoracic walls, ribs, vessels were intact. Lungs, there was bilateral edema with parenchymal hemorrhage. On heart and pericardium, there were unremarkable findings. On abdomen, there were no internal injuries. The liver, spleen, kidneys were intact and congested. In GIT, there were no significant findings. On oral cavity, there was an incised injury over soft palate. Discussion: the deceased 17-month-old girl had several antemortem wounds on her head, face, neck, and extremities, most of which were abrasion and contusions. The pattern, multiplicity, and bilateral distribution of injuries, especially over the face and head, are inconsistent with accidental trauma and are suggestive of repeated blunt force injury. Presence of crescentic abrasion indicates possible grip or nail marks, supporting assaultive etiology. The presence of intracranial hemorrhage in the absence of skull fracture is consistent with acceleration, deceleration forces commonly seen in repetitive blunt force trauma in progress. Here are some of the studies. In Geico studies, it was a cross-sectional retrospective analysis of medical records and legal documentation of maternal filicide cases. The key findings in that study was the study was conducted among 64 cases and found that 23% were less than 1 year old and 56% had maternal psychiatric diagnosis. In MES study, it was a systemic review of studies of acute head trauma in less than 5 years children. The 14 and children were stated and mortality rate victims from 13 to 35%. Autopsy findings were most 90 to 98% were SDH associated with multiple cranial fractures, and another common finding is SH. In Ghadi Pasha studies, it was a retrospective cross-sectional studies from 2008 to 2017. Reports of non-accidental child deaths among 86 cases. 34.9 cases were from 1 to 3 years and 20.9 cases were less than 1 year. Perpetrators included 44.2% were biological fathers and 31.4% were biological mothers. And the most common cause of death in this case study was smothering, followed by abdominal viscera perforation and multiple trauma. And the next study was Borget. It was a review done in Canada. It was a serious mental disorders had been noted in filicide with depression and psychosis reported most often. And last one was the Samir case report of a 1 year male child brought by father unconscious. It was a multiple injuries at facial level, anterior part of the thorax. There was subdural hematoma. The cause of the death was blunt trauma to the head in this case. The psychological testing analysis was no. These are some of my references.
What was missing in other studies is genital injuries. Did you find genital injuries in any of the studies which you saw?
No, sir.
Only in your case also.
Yeah, in my
history of filicide is there.
Yeah, history of?
History of filicide.
Yeah, history of
Parent killed.
Yeah.
But how do you conclude that mother killed? Genital injuries are there. Is there any family issues? Second marriage or something like that was there?
The child was there on the when father was continuously knocking the door, she was not opening the door. Eventually, the door was opened, and when he saw that the toddler, the child 17 months was lying on the floor. Initially, she said that she was doing house work, and she kept the child on a dining table which was somewhat high. And then she said that she fell from there by play. And then afterwards she said that someone was attempting to take the child. And after thorough investigation by the police, she said that she killed the child. Then she was taken to the psychiatry department. Then she was given some antipsychotic drugs, haloperidol and all. And then she said that after thorough investigation, she concluded herself that her husband was having an affair outside, and she was calling her since for 2 to 3 days, and he was not coming.
How did you conclude the mother killed the child?
She herself told to the police officer.
Yeah, it is history.
Yeah. She herself told.
Like, how do you explain the genital injuries in a 17-year-old female child? 17-month female child?
So she herself told.
Okay, thank you.
To the police officer, she herself.
Blood. Man, she's dead. Yes. Sir, మన ఏరియాలో ఒక మర్డర్ కేసు జరిగింది. Yes, sir. So it has come to the postmortem. You have to do the postmortem. This is the investigation.
ఏంటి ఏం పోస్ట్ మార్టం చేయాలి?
అవును సార్.
నేను ఎప్పుడు ఇంతవరకు పోస్ట్ మార్టం చేయలేదు కదా.
అంటే you murder case, sir. You have to do it. So we will help from our end, sir. Please.
ఓకే ఫస్ట్ టైం మరి ట్రై చేస్తాను.
నమస్కారం. WBNC నుండి మీ రిపోర్టర్ సహస్ర. ఇప్పుడే అందిన తాజా వార్త. బీబీనగర్కి చెందిన ప్రముఖ సైకియాట్రిస్ట్ డాక్టర్ మరియా మృతదేహాన్ని పోలీసులు గుర్తించారు. సిఐ ఎదుకుల్ ప్రసిద్ధ బిజినెస్ టైకూన్ కొడుకు జైన్ యొక్క రివాల్వర్ని గుర్తించి అతన్ని అరెస్ట్ చేశారు. ఏం చెప్తున్నారు? నాకే మస్తు వచ్చింది.
How many process? So there are two processes there, one hand anger, one down anger, one down chest. That's good, sir. I got a call from police station. Now he will be accident. Move it fast. He was not confessed. So not me. He called Susanna and see how it's for the side. He was president. Ideas. And we are going to suicide. Unless it's suicide. Seriously, we judging that. Suicide. Our system is maybe so eventually get working. After you make it. Generally, fundamental psychological issues. Maybe even unusual psychological tendency to think ఉండొచ్చు. సో అందుకే సీనియర్తో క్లోజ్ అవ్వడం అలా సీనియర్తో పార్టీలో బిహేవ్ చేయడం, క్యాంటీన్లో అందరం సీనియర్ మాలిష్ చేయడం, ఇదంతా నచ్చని సీనియర్ కోపంతో కొట్టడం పెడతారు. అప్పటికే నాగేష్ చనిపోవడం చూసి భయపడి సీనియర్ ఒక నుండి పారిపోతాడు. Based on autopsy findings, there is no foul play, there is no sense of violence and struggle. And defense in this. The injuries which I mentioned are very motivating. So, this is not a case of homicide and not a suicide either. Like I said, he was not trying to end his life. He was trying to feel better. But the lights of the oxygen restrictions going temporarily favorable some radiation. It's a case of accident and due to autolytic acids. Sometimes the truth does not feel much obvious for suicide. It simply lies beyond obvious. More than the homestead tax. So 100% money. So this is the solution. It is a tax. The tax is very costly. So you should say.
చూడడానికి ఫోన్ చేశాను
సరే ఎటువంటి వచ్చు మీరు రావాలి అవైలబుల్గా ఉందండి
సరే
మీరు వెళ్ళండి
చెప్తాను
రోజు వచ్చినట్టే వచ్చాను సార్ పనికి కానీ పొద్దున్నే వచ్చి చూస్తే ఎంటర్ ఉన్నారు సార్ చూడగానే ఫోన్ చేశాను సార్
సరే ఎప్పుడైనా పిలవచ్చు మీరు రావాలి అవైలబుల్గా ఉందండి
సరే సార్
మీరు వెళ్ళండి
సార్ పని అయిపోయింది సార్ ఇంటికి వెళ్ళిపోతాను
వెళ్ళిపోతారా? అక్కడ చిన్న పార్టీ ఉంది, కుక్ చేసి వెళ్ళిపోవడం.
1 hour please.
సరే
అది నైట్ పార్టీ చేసుకుందాం, అందరు మా ఇంటికి వచ్చి. ఓకే కదా? సరే రైట్.
సార్ సార్
వీడియో సార్ రవి.
చూస్తే పిల్లల్లో ఉన్నావు, ఎందుకు చంపారు వాడిని?
చంపడమా? నేను చంపడం ఏంటి సార్?
అవునా, రాత్రి ఉన్నారా? చెప్పు.
నేను ఎక్కడికి వెళ్ళలేదు సార్, ఇంట్లోనే ఉన్నాను సార్.
అది చేయగా ఇప్పుడు చెప్పరా, రాత్రి ఎక్కడ ఉన్నావు? పంచిపోకు.
చెప్తాను సార్, చెప్తాను. నిన్న రాత్రి 2 రోజుల కిందట అమ్మ కప్పుల వాళ్ళతో పెద్ద గొడవ. మా అమ్మ బాధ చూడలేక తను పనిచేసే ఇంట్లోనే దొంగతనానికి వెళ్ళాను సార్. కానీ నేను ఆ ఇంటికి వెళ్ళేసరికి డోర్ ఓపెన్ చేసి సార్. డబ్బు అవసరం వల్ల ఏం ఆలోచించకుండా అలానే నిలిపోయాను సార్. అలా రూమ్స్ అన్ని వెతుకుతూ బెడ్రూమ్లోకి వెళ్ళాను సార్. లోపల అతను పడుకొని ఉన్నాడు సార్. డబ్బు కోసం చూస్తుండగా అతని మొహం మీద రక్తం చూశాను సార్. దగ్గర చూడగా శ్వాస లేదు. తీరా చూస్తే ఒంటి మీద కత్తిపోయింది సార్. కానీ టెన్షన్లో బ్యాక్ మర్చిపోయాను సార్. వెనక్కి వెళ్ళి బ్యాగ్ తీసుకుని పాల్గొన్నాను సార్. అంతకు మించి నాకేం తెలియదు సార్.
నువ్వేంటమ్మా ఇక్కడ?
సార్ మా అబ్బాయిని ఎందుకు తీసుకొచ్చారు సార్? ఏమైంది సార్?
విమల రవి వాళ్ళ మదర్ సార్.
ఓహో, తల్లి కొడుకులు ఇద్దరు కలిసి బాగానే ప్లాన్ చేశారుగా?
లేదు సార్, నాకేం తెలియదు సార్.
అవునా? ఈ బ్యాగ్ ఎవరిదేగా?
అవును సార్.
మరి కత్తి ఈ బ్యాగ్ ఎలా వచ్చింది?
తెలియదు సార్.
దొంగతనానికి ఏదో ఓకే, మరి మర్డర్ చేశారా? దొరికిపోయావా?
లేదు సార్, మోడల్ కూడా కాదు సార్. అయినా వాళ్ళు ఎవరో చేసిన దానికి మమ్మల్ని అంటారు ఎందుకు సార్?
నైట్ గొడవలేదంటారు, ఏం జరిగిందా?
అదేదో తాగి మాత్రం చిన్న గొడవ సార్.
అది చిన్నదో పెద్దదో నేను డిసైడ్ చేస్తా కానీ గొడవ చెప్పు.
సార్ నేను తేజ పార్టీ పిలిచి వెళ్ళాం సార్. అనుకోకుండా తేజకి సందీప్కి గొడవ స్టార్ట్ అయింది. ఇద్దరిని కామ్ చేసి ట్రూత్ ఆర్ డేర్ గేమ్ ఆడాం. పార్టీ అయిపోగానే ఇంటికి వెళ్ళాం, అంతే సార్.
నేను ఎందుకు చంపాను సార్ తేజాని? నాకేం తెలియదు సార్.
అసలు ఏం జరిగింది?
నిన్న నైట్ గేమ్ ఆడుతున్నాం సార్. ఫస్ట్ నాకే రావాలా? గేమ్ ఆడుతున్నప్పుడు ఇంపార్టెంట్ క్లయింట్ కాల్ వచ్చింది సార్. సో మాట్లాడుతూ కిందికి వెళ్ళాను.
కాలేజ్ తిరిగి వచ్చేసరికి వీణారావు గొడవ పడుతున్నారు సార్. ఏమైందని ఎవరిని అడిగినా చెప్పలేదు. అంతకు మించి నాకేం తెలియదు సార్.
ఏంటి?
నిన్న రాత్రి ఏం జరిగింది?
ఎంత ప్రేమించాను సార్ మరి నేను, కానీ నేను ఇంత మోసం చేసి అసలు అనుకోలేదు సార్. మా అమ్మని కోరుకున్నాను సార్ నేను. ఇప్పుడు వాళ్ళకి నమ్మకం ఎలా సార్ చూపించాలి?
ఊరుకోమా ఊరుకో. సత్తి తీసుకెళ్తా. తేజకి ఏంటో గొడవ?
నాకు తేజకి సార్ గొడవ?
నీ బెస్ట్ ఫ్రెండ్ అయితే నాకు అన్ని చెప్పాడు. నిజం అప్పుడు నీకే మంచిది.
ఓ రోహిత్ చెప్పాడా? అసలు వాడి పేరు రోహితే కాదు సార్.
అరే బోర్ కొడుతుంది కదా, ఏమైనా గేమ్ ఆడదామా?
ఏం గేమ్ ఆడదామబ్బా?
గేమా?
లేదు లేదు లేదు, అంతాక్షరి ఆడదామా? ఫస్ట్ నాకే రావాలా? Guys, important phone call. Rohit.
చెప్పరా చూద్దాంటేరా. ఆల్వేస్ ట్రూ.
అబ్బో, అయితే ఒక సీక్రెట్ చెప్పు. ఇంతవరకు నాతో కూడా చెప్పుకోలేనిది ఎవ్వరికి చెప్పండి.
ఎవరికి చెప్పందంట బావో. ఎక్కువగా అలాగే చెరువు సీక్రెట్స్ ఏమంటే
కహానీలు కాదురా, సీక్రెట్ చెప్పమన్నా.
లాస్ట్ వీక్ ఎక్కడికి వెళ్ళారా మరి?
లాస్ట్ వీక్ తిరుపతి వెళ్ళాను.
అబ్బా, నాకేంటో చెన్నైలో కనిపించావు.
ఇక్కడే ఆగు తాగుతున్నా పాట.
ఇవ్వడా తాగుతున్నా?
ఆపండ్రా, ఏదో పార్టీ తీసుకుందామని వస్తే ఏంట్రా ఇది? సండే వాడి మర్యాద మాట్లాడని చెప్పు.
సొంత అమ్మ చదువు చేయడం నీకేంట్రా ఇచ్చారు మర్యాద?
రే, ఏం మాట్లాడుతున్నారా?
అసలు మన లాస్ట్ వీక్ వెళ్ళింది తిరుపతికే కాదు, చెన్నై సెంట్రల్ జైలుకి. అసలు వీడి పేరు రోహితే కాదు, వీడి పేరు భూతయ్య. ఏమైందిరా మాట్లాడలేదు?
ఏం బాగుతున్నారా?
నేను లాస్ట్ వీక్ చెన్నై వెళ్ళినప్పుడు చూసిన వీడి సెంట్రల్ జైలు దగ్గర. అక్కడ కనుకుంటే తెలిసింది
వాడు చెప్పింది నిజమేనా?
నీకు తెలియని సీక్రెట్ ఏంటి అడుగుతుంది, చెప్పు.
వాడు చెప్పింది నిజమేనా? ఏమైంది? ఏమైంది?
నా జీవితంలో రాసం నా చిన్నప్పుడు జరిగిన విషయం అది.
ఇంత పెద్ద విషయం నా దగ్గర దాచి మోసం చేశాం.
మనం హాబీకి పడుతుంది, కానీ ఆ పాస్ట్ గురించి ఎందుకు ఆలోచిస్తున్నాం?
ఓ అన్నని ప్రేమించాలని మా నాన్న అతన్ని మాట్లాడమే మానేశాడు, కానీ నేను ఇన్నప్పుడు లేదు.
ఎంతసేపు నీకోలే కానీ నా మాట వినవా?
చాలా ఓ సారీ ఉదయ్, అబద్ధం చెప్పుంటే వదిలేసేదాన్ని, కానీ నేను మోసం చేశాం. 5 years మన పరిచయంలో ఒక్కసారి నాకు చెప్పాలనిపించలేదా? నిజాయితీ నేను చోట్ల ఉండలేను.
అంతేసారి జరిగింది. వినాడు వాళ్ళకి ఇంటికి వెళ్ళిపోయా.
హలో
సార్, సిస్టమ్ కూడా పంపించాను.
అరే నాకు సందీప్ అని చెప్పాడు, మర్యాద నిజం చెప్పు.
సార్ వాడే వద్దని చెప్పాడు సార్.
వాడు చెప్పాడు, ఓకే. సిస్టమ్ వాడు చెప్తుందా? ఇప్పుడు నిజం చెప్పరా?
వాళ్ళు ఇంటికి వెళ్ళి నన్ను చెప్పేసాను సార్.
మళ్ళీ కథ పడుతున్నావు, నిజం చెప్పు, ఎలా చంపావని?
నిండుతోనే సార్.
కత్తితో పొడిచి
సార్ నేను చెప్పింది నిండుతుంది సార్.
నీకు ఇలా కాదురా.
ఆయన చంపి దొరుకున్నప్పుడు అబద్ధం నిజమే చెప్తాను సార్.
రే నువ్వు చెప్తే నిజమేనా?
నిజమే సార్. నిజమే సార్.
ఈ రోహిత్ గారు చెప్పేది నిజమే అనిపిస్తుంది. వీడు తిండితో చంపితే మరి కత్తితో పొడిచిన అజ్ఞాత వ్యక్తి ఎవరు?
అవునా సార్.
ఎక్స్క్యూజ్ మీ సార్.
శంకర్ రావయ్యా.
గుడ్ ఈవినింగ్ సార్.
గుడ్ ఈవినింగ్, కూర్చో. వెంకట్, ఆ తేజ పోస్ట్ మార్టం రిపోర్ట్ పట్టుకురా.
సార్ ఏంటి సార్ ఇది?
Yes, Shankar, death is by smothering, but also associated with 3 stab wounds. There are clear-cut signs of asphyxia. Mouth and nose chala pale ga undi. Inner part of the lips, frenulum has tears in it, and the tongue is also bruised. Ligature mark kuda ledu, and tracheal findings were insignificant, which confirms death is by smothering. Stabs విషయానికి వస్తే టోటల్ 3 stab wounds ఉన్నాయి. All 3 were inflicted on the left side of the chest and wedge shape. అంటే మనం ఇంట్లో వాడే కూరగాయలు కట్ చేయడానికి యూజ్ చేసేది అన్నమాట. వెపన్ దొరికిందా?
ఎస్ సార్, ఇంట్లో వాడే కత్తి.
గుడ్. స్టాబ్స్ ఆర్ నాట్ యాంటీమార్టం. అతన్ని చనిపోయాక ఎవరు పొడిచారు, బికాస్ హార్ట్ అండ్ అయాట పియర్స్ అయినా కూడా చాలా బ్లడ్ పోలేదు. In which case, those are post-mortem stab wounds. Stomach open చేసినప్పుడు alcoholic pungent smell వచ్చింది. So we have sent viscera for FSL.
Okay sir, thank you. సందీప్, తేజాన్ని చంపింది రోహిత్ గారే, కానీ కత్తితో పొడిచి కాదు.
అదేంటి సార్?
ఇది తేజ పోస్ట్ మార్టం రిపోర్ట్. దిస్ కన్ఫర్మ్స్ డెత్ ఇస్ బై స్మాదరింగ్. అంటే రోహిత్ చెప్పినట్టు తేజాని దిండుతో నిలిపి చంపేశాడు. మరి తేజాన్ని కత్తితో పొడిచింది ఎవరు? ఎవరే ఉంటారు? వినా, పోనీ సత్య? పోనీ నువ్వు చెప్తావా శాండీ? నీకేంది లేదా? మరి 12కి వాడి ఇంటి దగ్గర ఏం చేస్తున్నారా? వచ్చానా? నేను నైట్ ఆ ఇంటి దగ్గర లాస్ట్ చేసిన సిగ్నల్ ఇదే. 12కి తేజ ఇంటికి వెళ్ళావు, వాడిని పొడి చేసావు, కానీ ఎందుకు పొడిచారా?
FSL reports.
ఇంకా నిన్ను ఎవ్వరు కాపాడలేడు. మిస్ సత్య, నువ్వు చెప్పినందుకే పొడిచాడు వాడు. సత్య, ఇవి మీ నాన్న వాడే యాంటీ క్యాన్సర్ మెడిసిన్సేగా. వీటి ట్రేసెస్ ఈ గ్లాస్ లో అండ్ ఇంకా తేజగాడ బొడ్లో దొరికాయి. అండ్ ఈ గ్లాస్ మీద తేజ ఫింగర్ ప్రింట్స్ తో పాటు నీ ఫింగర్ ప్రింట్స్ మాత్రమే దొరికాయి. ఇప్పటికైనా నిజం చెప్తావా? ఓని నేను చెప్పనా?
అది ఏమైందిరా?
అంతా నీలాంటి నమ్మక ద్రోహుల వల్లే.
ఏం మాట్లాడుతున్నావురా?
ఏ ఆపవే, నువ్వు ఆ సందీప్ వర్గ కూతుల విషయం నాకు తెలియదు అనుకుంటున్నావా?
మన మధ్యనేమో నిన్ను కాపాడడానికి ఏదో కత్తితో పొడిచి ఆ కత్తిని దొంగతనానికి వచ్చిన రవి గారి బ్యాగ్లో పడేసి కేసు డైవర్ట్ చేద్దాం అనుకున్నాడు. ఏం సార్ అంతేనా? 6 months నుండి మీ ఇద్దరు కంటిన్యూ మాడుకున్న కాలేజ్ ఇది సరిపోదా మీ ఇద్దరు ఎఫెక్ట్ ప్రూవ్ చేయడానికి? చంపాలనుకున్న సత్య, చంపింది రోహిత్. అనవసరంగా నువ్వు బుక్ అయిపోయావు కదా శాండీ.
The next short film is The Hall, presented by Gandhi Medical College.
ఓకే మరి వెళ్ళొస్తాను.
కాసేపు ఉండేదచ్చు కదా.
లేట్ అయిపోయింది. ఏమన్నా బాయ్.
బాయ్. You guys carry on, Vimurta. Thanks,
suspicious? Not yet. Most probably staircase in Purple Center. Any further? If I am waiting, it might be available. Might be an accident. Might not be. I know it because what you thought. You put the button on the question. You will never post that. Let's search. Sir. ఫుడ్ టెస్ట్ కోసం ల్యాబ్కి పంపించండి. మన ఫ్రెండ్స్ అందరూ ఎక్కడ ఉన్నారు? కింద సెల్లార్లో ఉన్నారు సార్. వెళ్ళాం. లైఫ్ పార్టీ ఇక్కడే ఉన్నాను. అవును సార్. దేనికి పార్టీ? అంటే మన బర్త్డే ఉంది సార్, అందుకే. బర్త్డే పార్టీ ఇంత అవుట్స్కట్స్ లో డ్రగ్స్ తీసుకున్నారా? పెట్టుకోలే. మార్నింగ్ అతను ఎవరు చూసారు ఫస్ట్? నేనే సార్. మీరు ఇచ్చిన ఫుడ్ శాంపిల్స్ లో పాజిటివ్ రిజల్ట్స్ దొరికాయి. బాడీ కోచ్ ఇంకా ప్రోగ్రెస్ లో ఉంది. మనకు 2 రోజుల ఫుడ్ లో పాజిటివ్స్ ఉన్నాయండి సార్. ఫుడ్ ప్రిపేర్ చేశారు? ఆర్డర్ పెట్టాను. పెట్టింది ఎవరు? వివేక్ ఆర్డర్ పెట్టారు సార్. పిక్ చేసుకుని ఎవరు? వివేక్ ఆర్డర్ పిక్ చేసుకున్నారు. అంటే ఇప్పుడు వాడే ఆర్డర్ పెట్టుకుని వాడే విషయం కలుపుకొని వాడే చేసి వెళ్ళిపోయాడు. అంతే మీరు అనేది?
పాయిజన్ పెట్టి చంపడం ఏంటి?
ఇంట్రాగేషన్ చేయాలి. ఎలా పరిచయం?
వివేక్ నా బాయ్ ఫ్రెండ్. మేము స్కూల్లోనే పరిచయం.
మేము వాళ్ళ కాలేజ్ ఫ్రెండ్స్. నేను మాయా ఫ్రెండ్ అండి సార్. వివేక్ నాకు అలానే పరిచయం. నాకు వివేక్ పబ్లో పరిచయం అండి సార్. నేను అప్పటి నుంచి వానికి డ్రగ్స్ సప్లై చేయడం స్టార్ట్ చేశాను.
నేను మాయా ఫ్రెండ్. నాకు వివేక్ అలానే పరిచయం.
వాడు నా కజిన్ సార్. చిన్నప్పటి నుండి కలిసే వివేక్ మీద కూర్చుంటారు.
నేను చెప్పలేదు సార్. నేనే కదా సార్ మీకు ఇన్ఫార్మ్ చేసింది.
నేను చెప్తాను సార్. నాకు నమ్మకం పరిచయం అండి.
నేను కలిసిందే ఈరోజు. అసలు ఆయన సంపాదించిన అవసరం నాకేంటి?
నేనెందుకు చంపుతా సార్?
నేను చెప్పాను ఏంటి? తన బాయ్ ఫ్రెండ్. నేను ఎందుకు చంపాలనుకుంటా?
నేనెందుకు చెప్తాను సార్? ఏ పర్మిషన్ తో ఇంట్రాగేషన్ చేస్తాను? అయినా సైనట్ కూడా వెతికి ఫింగర్ ప్రింట్ తీసుకోండి సార్. ఓ సైనట్ తో ఉంటారా? మాకే తెలియదురా. నార్మల్గా సైనట్ అనుకున్నాను సార్. ఇన్ లైక్ వివేక్ కాల్ రికార్డ్స్ చెక్ చేశాను. తన పేరెంట్స్ కి కాల్ చేసి నువ్వు ఇచ్చిన ఫుడ్ తిన్నాకనే తనకి ఏదో అవుతుందని చెప్పారు. ఆ రికార్డింగ్స్ మా దగ్గర ఉన్నాయి. ఎందుకు చంపారు? నా పేరు చెప్పిండా? అసలు ఏమైనా ఉండేవాళ్ళు సార్. తన పేరెంట్స్ తో కాల్లో నీ పేరే చెప్పాడు.
నాకే చెప్పడం ఏంటి? అసలు నేను దానికి పార్టీలో లేదు. ఫుడ్ ఇస్తా.
ఎందుకు చంపారు? నేను చీకట్లో రాయేసా, నువ్వే పట్టుకున్నావేరా. చంపాడు.
వాళ్ళ ఫ్యామిలీ మాకు చాలా ద్రోహం చేసింది. వాళ్ళ వల్ల మేము చాలా నష్టపోయాం సార్. మా నాన్న సూసైడ్ చేసుకున్నాడు సార్.
అప్పుడే వాడిని చెప్పాలనుకున్నాను.
అందుకే 1 ఫుడ్లో సైన్ అనేది అన్నాను సార్.
సక్సెస్ కేస్ క్లోజ్డ్. అక్యూట్ స్టేట్మెంట్ కలెక్ట్ చేసుకోండి. డ్రగ్స్ కోసం డేవిడ్ లోపలేయండి. Sure, Nandini. Hello, autopsy reports వచ్చాయి. బాడీలో ఎలాంటి పాజిటివ్ రెసిస్ట్ లేదు. What?
అందుకే 1 ఫుడ్లో సైన్ అనేది అన్నాను సార్.
బాడీలో ఎలాంటి పాజిటివ్ రెసిస్ట్ లేదు. ఇట్స్ న్యాచురల్. ఫుడ్ లో పాయిజన్ దొరికిందన్నారు. నేచురల్ డెత్ అంటున్నారండి సార్. ఫుడ్ లో పాయిజన్ దొరికిందని, కానీ బాడీలో ఎలాంటి రెసిస్ట్ లేదు.
మరి ఆల్రెడీ వాడు చంపినట్టు ఒప్పుకున్నాడు కదా.
మరి దేని వల్ల చనిపోవాలంటారు? ఫ్యాట్ ఎంబాలిజం
అంటే ఫ్యాట్ ఎంబాలిజం అంటే మన బ్లడ్ సర్క్యులేషన్ లోకి ఫ్యాట్ డ్రాప్లెట్స్ వచ్చి బ్లడ్ వెసల్స్ ని అబ్స్ట్రక్ట్ చేయడం, లంగ్స్ కి సప్లై చేసే బ్లడ్ వెసల్స్ ని అబ్స్ట్రక్ట్ చేయడం వల్ల లంగ్ డ్యామేజ్ అవుతుంది. కొన్ని కేసెస్ లో ఫ్రాక్చర్స్ వల్ల కూడా ఫ్యాట్ ఎంబాలిజం జరుగుతుంది. ఫ్రాక్చర్ అయినప్పుడు బోన్ మ్యారోలో అటాక్ బ్లడ్ వెసల్స్ లోకి ఎంటర్ అవుతుంది.
ఈ ఫ్యాట్ వల్ల పల్మనరీ ఎంబాలిజం జరుగుతుంది.
వివేక్ లాంటి ఇష్యూస్ లో కూడా మనకు ఫ్యాట్ వెసల్స్ దొరుకుతాయి.
మరి వివేక్ కేసులో ఎలా జరిగిందంటారు?
వివేక్ కేసులో ఇలా జరగవచ్చు. ఆందోళన దానివల్ల తన ఫీమర్ కి ఫ్రాక్చర్ జరిగింది. ఆ ఫ్యాట్ లంగ్స్ కి రీచ్ అయ్యాక పల్మనరీ ఎంబాలిజంతో చనిపోయి ఉండవచ్చు. It's an open and shut case, a natural death.
What?
మళ్ళీ ఎందుకు పెట్టారు సార్? చంపినా దొరికాడు అంటారా?
మీకు చనిపోయింది సైలెంట్ పాయిజన్ వల్ల కాదు. పాయిజన్తో చంపడం వాడకపోయాడు అసలు. మరి ఇంకేంటి? పాయిజన్ కలిపిన వాటర్ నిజం, కానీ వాడు చనిపోయిన దాని వల్ల కాదు. ఇట్స్ న్యాచురల్ డెత్
నేచురల్
అన్నట్టు ఫ్రేమ్ చేశారు.
It's not a natural.
What?
There is a shift in the light notice.
అంటే
మనిషి చనిపోయాక సర్క్యులేషన్ ఆగిపోయాక బ్లడ్ వెసల్స్ లోని ఫ్లూయిడ్ ఎక్కడికక్కడ ఫిక్స్ అయిపోతుంది. ఈ ఫిక్సేషన్ టైం 6 hours. ఈ 6 hours లోపు బాడీని జరిపితే
ఫ్లూయిడ్ కూడా డిస్ప్లేస్ అయ్యి ఫిక్స్ అవుతుంది. దేనిలో విల్ షిఫ్టింగ్ అలాగే అన్నమాట. ఈ కేసులో కూడా అలానే జరిగింది. వేక్ బాడీని కూడా ఎవరు చనిపోయాక డిస్ప్లేస్ చేశారు. ఇట్ మైట్ బి అన్నమాట.
ఇందాక నేచురల్ డెత్ అన్నారు, ఇప్పుడు ఎవరు బాడీ డిస్ప్లే చేశారు అంటున్నారు. అసలు ఏం జరిగింది సార్?
ఇలా జరిగి ఉండొచ్చు. వివేక్ ఆల్కహాల్ ఎక్కువ తాగడం వల్ల స్ప్రో కోల్పోయి ఉంటాడు. ఆ టైంలో ఎవరో వాంటెడ్లీ అతని బాడీలోకి లిపిడ్స్ ఇంజెక్ట్ చేశారు. అతని కాలు బ్రేక్ చేసి ఫ్రాక్చర్గా ఫ్రేమ్ చేశారు. ఫ్యాటమ్ వల్ల జమై అతను చనిపోయేదాకా వెయిట్ చేశారు. తర్వాత అతన్ని సేఫ్ దగ్గర షిఫ్ట్ చేసి నేచురల్ డెత్ లా ఫ్రేమ్ చేశారు.
ఎందుకు చంపాం సార్ వాడిని? అదే కదా మీరందరూ ఎందుకు చంపాలనుకుంటారు? చంపాలి.
నేను చంపాను సార్, అసలు పెట్టుకోవడానికి నేను బాగుంటుంది చెక్ చేసుకోండి.
అందుకే ఎందుకు చంపారు అంటున్నా. ఎందుకు చంపారు? ఇంత ప్లానింగ్ తో చేశారంటే వాళ్ళకి ఖచ్చితంగా మెడికల్ బ్యాక్గ్రౌండ్ ఉండి ఉంటుంది.
ఆయన వెయిట్ చేయాలి. బీటెకే కదా, వాళ్ళ ఫ్రెండ్స్ అందరూ కూడా బీటెకే అంటారు.
యా కరెక్టే, అందరు బీటెకే, ఒక్కరు తప్ప.
ఎవరు?
మాయా.
మాయా డాక్టర్ మీకెలా తెలుసు?
స్కూటీ మీద డాక్టర్ సింగర్. మెడికల్ బుక్స్.
కానీ ఆ టైంకి మా ఇంట్లో ఉన్నట్టు మన దగ్గర ఎవిడెన్స్ ఉన్నాయి కదా.
మనం ఇలా అనుకోవాలని తన ఇంటికి వెళ్ళి ఉంటుంది. డెఫినెట్గా ఎవరో ఇచ్చేస్తున్నారు.
ఎవరు ఉండొచ్చు?
మన కాలేజ్ సింగర్.
వాట్ సార్ ఇది చూడండి సార్. నిన్న మాయ ఫోన్ నుంచి హర్షగడికి 11 అవుతుంది. నియర్లీ 2 hours హర్షగడ్తో కాంటాక్ట్లో ఉంది మాయ.
ఎస్, మాయ హర్ష ఇద్దరు కలిసి చంపారు. ఎందుకు చంపారు?
నేను కూడా రిలేషన్షిప్ లో ఉన్నానన్న నిజమే, కానీ నేను ఎప్పుడూ హ్యాపీ అయ్యాను.
వివేక్ మాయ చాలాసార్లు బాధపడింది సార్. తను బాధపడడం వల్ల నేను వచ్చాను.
ఆ విధంగా నేను నష్టాపోయాను.
వివేక్ తో మాయ నచ్చలేదు,
అందుకే
నేను మాయ కలిసి వివేక్ చంపేసి
ఇంత ప్లాన్ చేసావు కరెక్టే, కానీ బీటెక్ చదివే హర్షకి డ్రైవర్ మాట ఎక్స్ప్లెయిన్ చేయలేదా? కేస్ క్లోజ్డ్.
సార్ దురదర్శనం బాగుందంట కదా.
కేసు సాల్వ్ అయిపోయింది కదా, ఈవినింగ్ వెళ్దాంలే.
హలో సార్, మనకి ఇంకో గేమ్ వచ్చాం
సరిపోగా
సార్. మరి దురదర్
నెట్ఫ్లిక్స్ లో చూసుకున్నాంలే.
Morning, guys. Pardon, Krishna. Today, I will be taking class on how to investigate crime. Crime. Crime is clue. మనం ఆక్టివిటీ చేసుకొని చేసుకోవాలి. ఒకవేళ ఆక్టివిటీ చేసినా కానీ ఫోరెన్సిక్ వాళ్ళు ఆక్టివిటీ కష్టాలు సో చేసుకోవాలంటే ఫోరెన్సిక్ వాళ్ళు ఇండికేటర్ చేసుకోవచ్చు.
వాళ్ళతో మాట్లాడి సార్ మళ్ళీ ఆన్సర్ సాటిస్ఫాక్షన్ ఆఫ్ డేటా కానీ ఒక్క కేస్ నా పేరు మార్చు
ఎవరు?
గుడ్ మార్నింగ్ మేడం.
ఏంటి?
కేసు వచ్చింది మేడం.
ఏం కేస్?
అదే మేడం
ఇక్కడ ఇవ్వు.
సూసైడ్ కేసు.
నువ్వెందుకు వచ్చావు? నీ ఐడియా చేసుకున్నా.
బిజీ ఉన్నాను.
నువ్వే ఒక కేసు ఉందంట చూడు.
అది చూడు.
ఏంటి ఎంజాయ్ చేస్తారా? ఎక్కడికి వస్తున్నావు? ఇది స్టేషన్ కాదు, ఇది మా ఆబ్జెక్ట్. సరే ఏంటి లేదు రౌండింగ్ చేసే కదా ఎంజాయ్ చేస్తారా? అసలు నువ్వు ఏ కేసు అనుకుంటున్నావు? నేను సింపుల్ రౌండింగ్ కేసు. ఇండియా అంతా సింపుల్ రౌండింగ్ కేసు. There are injuries on the body, possibly assault జరిగింది, murder అయ్యే ఛాన్స్ కూడా ఉంది. And moreover, this is also a possibility of rape. ఎందుకంటే మన సివిల్ ఏదైనా స్లాబ్స్ పెట్టాను, ఆ రిపోర్ట్ వచ్చేంత వరకు ఏం చెప్పాలి. అండ్ మోరోవర్ బాడీ ఓపెన్ చేయడానికి ఒక ఎక్విలెస్ స్మెల్ వస్తుంది. దాన్ని మనం నిజంగా కెమికల్ అనాలిసిస్ మనకి ఆ రిపోర్ట్ వస్తే ఏమని మన సివిల్ చెప్పాలి.
year-old appointed boy. ఊరవతల చెరువు పక్కన. ఏమై ఉంటుంది? సూసైడా? No chance. Only murder? What could be the cause? What could be the motive? ఆస్తి కోసమా? No. We have a poor family. Only 11 years? No chance. తన మెంటరీ లాంటిది. అసలు హంతకుడి ఉద్దేశం ఏంటి? హంతకుడు ఒకడా? More than one person. Think what she think. ఆ ముగ్గురు రూమ్కి వచ్చి మెంటల్ నా కొడుకులు నాకు అస్సలు మర్యాదగా నాకు కోఆపరేట్ చేస్తారా లేదా నా స్టైల్లో చేయించమంటారా? చెప్పరా? చెప్పు. నువ్వే నాకు తెలుసు. చెప్పరా? మర్యాదగా చెప్పండి ఎవరు చేశారు, లేదంటే నీ ముగ్గురికి ఇదే ఆఖరి రోజు. Sir, we have to look at this. ఏమైంది ఒకటే కదా సార్ చెక్ చేయండి. ఒకటే గుడ్ థ్యాంక్ యూ సార్.
హలో సార్, గుడ్ మార్నింగ్ సార్. నేను ఎఫ్ఎస్ఎల్ నుంచి మాట్లాడుతున్నా సార్. మేము పంపిన స్లాట్స్లలో ఒక సింగిల్ శాంపిల్ డిటెక్ట్ అయింది సార్. సో మోస్ట్లీ దీంట్లో ఒకటే పర్సన్ లింగోలో ఉంటారు సార్.
మార్నింగ్ సార్. గుడ్ మార్నింగ్. మొన్నటి కేసు రిపోర్ట్స్ ఏమన్నా?
రిపోర్ట్స్ అన్ని వచ్చేసాయి సార్. హియర్ ఇస్ ద పోస్ట్మార్టం రిపోర్ట్ అండ్ దీస్ ఆర్ ద రిలేటెడ్ రిపోర్ట్స్. సో as they expected, semen analysis report was positive. They checked in it and they also detected chemical turpentine oil in chemical analysis of TGAF. Also, sir, the very crucial thing is the trace evidence that we have detected. Many scratch operations though, that is from the paint detected. So these are the crucial clues.
మీరు చెప్పేదాన్ని బట్టి చూస్తుంటే అంతకుడు ఇంజురీస్ అలాగే రేప్ చేసినట్టుంది. వై కాంట్ సింప్లీ రేప్? ఎందుకు ఇంతలా ఇంజురీస్ చేసి ఉండొచ్చు?
ఈ కేసులో మెయిన్లీ ఆ ఇంజురీ ప్యాటర్న్ చూస్తే అంతకుడు ఒక స్టాటిస్టిక్ బిహేవియర్ ఆఫీస్. సో మేబీ పర్సన్ వ్యక్తి ఒక సైకోపాత్ అయ్యాడు.
మీరు చెప్పే క్లూస్ చూస్తుంటే గోళ్ళలో పెయింట్, కడుపులో టర్పెంటైన్ ఆయిల్, సిమెంట్ స్టేన్స్, ఇవన్నీ కలిపి చూస్తుంటే మనం వెతికే హంతకుడు ఒక సాటిస్టిక్ పెయింటర్ అయి ఉండాలి. థ్యాంక్ యూ సార్. థ్యాంక్ యూ ఫర్ క్లూస్. ఇంతకీ ఆ అమ్మాయి దేని వల్ల చనిపోయింది సార్?
సో కాజ్ ఆఫ్ డెత్ వచ్చేసి మల్టిపుల్ ఇంజురీస్ అవుతాయి. ఫస్ట్ తల వెంట బలమైన రక్తగాయం, ఛాతీలో మల్టిపుల్ లింక్ ఫ్రాక్చర్స్, పొట్టలో స్ప్లీన్ రప్చర్ అవుతుంది, and there is massive bleeding per patient. So all these injuries cause massive bleeding and that finally causes the death.
థ్యాంక్ యూ సార్. థ్యాంక్ యూ ఫర్ క్లూస్.
All the best.
బాడీ పైన స్క్రాచ్ ఆపరేషన్స్, ఈ నెయిల్ స్క్రాచ్ ఆపరేషన్స్ లో పెయింట్. సో హంతకుడు పెయింటర్ అయి ఉంటాడా? ఎవరు ఈ సైకో పెయింటర్? చెప్పు పెయింటర్స్ అదే లేక కట్టు సార్. రామో సింగిల్స్ అనుకుంటున్నాను. లక్ష్మి సార్ ఏం జరిగిందా పాప?
కూర్చోగా చెరువు దగ్గర చనిపోయి పడిందని అందరూ వాళ్ళు అనుకుంటారే.
చనిపోయిందా? చంపేశారు?
నాకేం తెలియదు. వాళ్ళు మళ్ళీ
మీ ఏరియాలో ఆ పాప ఒంటి పైన పెయింట్ పడతాడు. నువ్వు కాకుండా ఏం వస్తున్నాడు?
వారం క్రితం వచ్చాడు. రాత్రి పూట ఇంటికి మీటింగ్ అడిగాడు. నేను రాత్రి పూట వెళ్ళాను, నాతో కాదని చెప్పాడు. మాటికి వచ్చి సలహా ఇచ్చేసరికి నా దగ్గర ఉన్న పెయింట్ బ్రష్ అని అతనికి ఇచ్చేసాను.
రాత్రి కూడా పెయింటింగ్ ఏం సైకిల్ రాత్రి కూడా పెయింట్ అసలు
గురించి కొత్త ఇల్లు కట్టుకున్నాను. మన పేరు సైకో స్టూడియో.
సైకో స్టూడియో ఏంటి మళ్ళీ వీడియోస్ కదా? సరే మీరు ఎగ్జాంపుల్ తీసుకోండి. ఏది మ్యాచ్ పంపించు చూద్దాం. సైకో ద్వారా సైకో స్టూడియో
ఇవ్వడం నచ్చదు.
ఇలా చంద్ర అసలు ఎందుకు చంద్ర
నేనే చంపేశా, సరదాగా చంపేశా.
ఎంత బాగుంటుందో తెలుసా?
ఇదే నొప్పి ఇంకొకటి ఇస్తే ఎలా ఉంటుందో తెలుసా? సమ్మగా ఉంటది. అందుకే చంపేశా, నేనే చంపేశా.
అలా ఆ రోజు ఒక సాధారణ మామూలు సూసైడ్ అయిన ఆ కేసు ఫోరెన్సిక్ కాలేజ్ క్లూస్ వల్ల బ్రూటల్ కోల్డ్ బ్లడెడ్ తెలిసింది. వాళ్ళు ఇచ్చిన ఆ పెయింటర్ క్లూ presence of semen ఈ రెండు క్రూషియల్ టు క్యాచ్ ద సైకోటిక్స్ సీరియల్ కిల్లర్. సో రిమెంబర్ గైస్, ఎప్పుడైనా కానీ మీ కేసు సాల్వింగ్ ఈజీ అవ్వాలన్నా, కాంప్లికేట్ కాకుండా ఉండాలన్నా ఆల్వేస్ ఇంటిగ్రేట్ ఫోరెన్సిక్స్. టు సర్వ్ జస్టిస్, కోఆర్డినేషన్ బిట్వీన్ డాక్టర్, పోలీస్ షుడ్ బి దేర్.
చుట్టూ నడుస్తున్న ప్రపంచంలో అనేక రకాల ప్రమాదాలు, ఆపదలు జరుగుతుంటాయి. ఆ ప్రమాదాల ప్రతిఫలం గాయం. ప్రతి గాయం ఒక కథ చెప్తుంది. ఆ కథ చదివేది ఫోరెన్సిక్. అపరాధి ఎంత తెలివిగా దాచినా వాటిని అంతే తెలివిగా నిజం కోసం ఆరా తీసేది ఫోరెన్సిక్. నిజం ఎప్పటికైనా వెలుగులోకి వస్తుంది, కానీ ఆ నిజానికి వెలుగు మార్గం చూపేది ఫోరెన్సిక్. When people lie, evidence speaks. We dedicate this movie to all the unsung heroes of forensic, those who testify for the dead.
Moving on to the next short film. The next short film is Madhulur Murders, presented by GMC Nizamabad.
అత్యంత ఘోరమైన కేసెస్లో ఇది ఒకటి. జాలి దయ లేకుండా చాలా దారుణంగా చంపేశారు. వాళ్ళ ముగ్గురు అన్నదమ్ములు. డబ్బుల కోసం వాళ్ళు ఎవరినైనా చంపుతారు. ఇప్పటికే వెలుగుగా డెకాయిటీ, మర్డర్ ఇలా చాలా కేసులు. ఎక్కడ ఉంటారో తెలియదు, ఎప్పుడు చంపేస్తారో, ఎక్కడికి పోతారో ఎవరికి తెలియదు. The most wanted criminals in this history.
Three bolts on our side and track. Money the motive, night goes black. Force remembers every attack, no mercy, no warning, no echo, no plea. Deep in the forest. Following the leaves from every at night. 3 in the dark, no fear, no light. Cold eyes up, we ready to strike. Step in the woods, you put on sight. Time up quick, roll no wrist, fading the bar, running the miss, catching the bag, murder the kicks. No second chance on the blade, just twist. Reach out of the whip, murder the ground, no next no mercy found. Money the sound, deep in the forest, money don't fear no love, no rest. Feelings and bone, but if you see us, don't look back. 3 bolts on our side and track. Money the motive, night goes black. Force remembers every attack, no mercy, no warning, no echo, no plea. Deep in the forest. Just pray.
పాటూరులో దారుణం. అటవీ ప్రాంతంలో 2 మృతదేహాలు. గుర్తు తెలియని వ్యక్తుల హత్య. పోలీసుల దర్యాప్తు. తెలివిగా 12 ఇంత దారుణమా? 2 భార్య భర్తలు చంపేశారు.
నువ్వు కూడా కొద్ది బయట తిరుగుతున్నావు కదా, జాగ్రత్తగా ఉండు.
నమస్తే కృష్ణ.
హ్యాపీ హోలీ ధర్మ.
చాలానే తెలుసు. ఏమైందన్నా తెలుగున్నావు?
ఏం చెప్పమంటావు ధర్మ? నెక్స్ట్ మంత్ చెల్లి పెళ్లి ఉంది. డబ్బులు ఎవరు ఇవ్వట్లేదు. టెన్షన్ అయిపోతుంది నాకు.
పెళ్లికి డబ్బులు కావాలి.
వరకట్నం 10 లక్షలు అడుగుతున్నారు. మిగతా ఖర్చులు అంటే 10-15 లక్షలు అవుతాయి. అంటే 20-25 లక్షలు అవుతాయి కర్మ. పొలం స్థలము బ్యాంకులో ఉంది. నా పేరు మీద ఇల్లు మాట్లాడే అంతే.
ఇల్లు ఉంది కదా, అది రిసర్వ్ అడుగుతాను.
సరే ధర్మ నేను తీసుకొస్తా. ఆ ఒక్క ధర్మ.
సరే ఇచ్చేసి 2 రోజులు
థ్యాంక్ యూ రా.
ఏమంటే రోజు బయట తెచ్చుకున్నాం కదా మరి చేయలేదు డబ్బులు అడ్జస్ట్ అయ్యాయా? కొన్ని రోజులే ఉంది కదా మ్యారేజ్ కి.
అదే దీనిగా ఇట్లే డబ్బుల గురించి తిరిగి వచ్చిన ఎవరు ఇవ్వట్లేదు. మధ్యాహ్నం ధర్మ కలిసిండు, డబ్బులు ఇప్పిస్తా అని చెప్పిండు. కాకపోతే ఇల్లు పేపర్లు పెట్టమని చెప్తున్నారు.
ఇల్లు పేపర్ రా, చెల్లి పెళ్లి కోసం ఇల్లు పేపర్లు పెడితే మన పిల్లల భవిష్యత్తు ఏంటో ఆలోచించినావా?
నానే ఆలోచన ఏంటి, ఇల్లు పేపర్లు పెట్టకుండా డబ్బులు ఎవరిస్తారు? చెల్లి పెళ్లి ఎవరు చేస్తా చెప్పు. మీరు ఏమైనా చేసుకోండి, నేను ఇల్లు పేపర్లు పెడుతున్నా, డబ్బులు తీసుకుంటున్నా, మీ ఇష్టం.
చెప్పేది మన మంచి కోసమే, తర్వాత ఏమన్నా చేసుకోండి ఇష్టమిగా.
ఇప్పుడే విషయాలు అవుతుందా? ఏ కృష్ణాడు అది మనిషి అవునా వాడే ఏంటంటే వాడికి చెల్లిపల్లి పెట్టుకోరు 7 లక్షలు కావాలంట. 30 లక్షలా? 20 లక్షలు అంటే పెద్ద ఉంటారా? డీల్ పేపర్లు ఒకటే వాడంట. ఇదే కరెక్ట్ అంట. ఏదో ఒక చేసి 500 తగ్గించుకోవాలి. నా దగ్గర ప్లాన్ ఉంది, అది వర్కౌట్ అయితే మన లైఫ్ మొత్తం సెటిల్ అయిపోతుంది. రెడీ ఆ ఇల్లు మనకి కావాలంటే ఆ ఫ్యామిలీ ఫస్ట్ మనం బలిస్తాం, తగ్గిస్తా పంపించి మనం చదువుతాం, బాడీ ఎవరిద్దరు ఉండాలి, ఎవరికి టేస్ట్ కూడా
ఎక్కడికి రావాలి? నేను చెప్పిన వచ్చాను.
వచ్చారా? ఆ పేపర్స్ మా తమ్ముడికి ఇచ్చేయండి, వాళ్ళు మీకు పైసలు ఇచ్చేస్తారు. నేను ఒక చిన్న పనిలో ఉన్నాను, వస్తున్నాను.
నమస్తే. ధర్మ ఎక్కడ? ఇల్లు పేపర్ తీసుకురామని చెప్పాడు. డబ్బులు అవసరం ఉంది నాకు. నేను ధర్మ ఫోన్ చేయరా, డబ్బులు తీసుకొని నేను వెళ్ళాలి. నేను వద్దా, నేను తాగా. అరే వద్దరా, నేను బద్దయ్య రా, టైం లేదురా.
కృష్ణ ఇల్లు మన పేరునే కాదని మా పాత పేరు రాపిస్తాను. ఏమంటావు? ఏమంటారా?
ఇల్లు వస్తే నాకు ఇల్లు రావాలి.
ఏం మాట్లాడుతున్నా? తాగి పెట్టిందా ధర్మ ఫోన్?
ఏం మాట్లాడుతున్నారా?
అప్పుడు ఉంది అది ఎప్పుడు నాకు ఇచ్చారా? చెప్పేసి నాకు ఎప్పుడు నాకు ఇచ్చి నేను వెళ్ళిపోతాను. అదే పని చేసాను.
సమయం రావాలి. నెక్స్ట్ వాళ్ళ ఇంటికి వెళ్ళి అక్కడే చంపేసి ఇంట్లోనే వదిలేసేస్తారు. అందరూ దాన్ని చూసే అనుకుంటారు. అప్పుడు మనం ఇంకా ఎవరికి రాదు. ఏమైనా కృష్ణుడు సీనియర్ పేపర్లే వస్తుంది. ఏం రాలేదన్నా,
క్లాస్ వైస్ నానే కదా. ఒకవేళ పిల్లలకి మన మీద వస్తే ఏం చేద్దాం?
అవునా, ఇదేద్దాం మరి. చేయలేము.
రెండు రోజుల తర్వాత కృష్ణ భార్య ఇంట్లో వేస్తున్నారు. ఒకే ఫ్యామిలీలో వెంటనే ఇద్దరు చనిపోవడం వల్ల మాకు డౌట్ వచ్చింది. ఈ కేసు ఇన్వెస్టిగేట్ చేసినప్పుడు కృష్ణ బాబు మోసపోయింది.
We received information from police and conducted exhumation in Martu village.
That the body was in the late stage of decomposition, and we found the comminuted fracture of the bones of the cranial wall, which involves the frontal, parietal, and the temporal bone, along with the presence of diffuse subarachnoid hemorrhage all over the brain. And the cause of death of this disease is blood injury death.
ఇంకా వాళ్ళ ఫ్యామిలీలో మిగిలింది కృష్ణ గారి కొడుకు వాడి చెల్లి. వాళ్ళ చెల్లిని ఎలాగైనా కిడ్నాప్ చేసి నదిలో విసిరేస్తారు. మా ఇల్లు మాత్రం
కృష్ణాన్ని మన పిల్లాన్ని చంపేసినావా? ఇక ఇల్లు ఆల్మోస్ట్ మన పేరుకి వచ్చేసినట్టే. ఇంకా రోజులైతే మన పేరుకి వచ్చేస్తుంది. అంత సెట్
తెలియదా వాళ్ళ కొడుకున్నాడు వాళ్ళ చెల్లెల్ని
మీరు ధర్మా కదా? మా అన్నయ్య 2 days దాకా మీ దగ్గరికి మనీ తీసుకోవడానికి వస్తాను. వచ్చారా?
వచ్చినారు, పేపర్ తీసుకున్నాం, పైసలు ఇచ్చేస్తాం.
లేదండి, ఆ రోజు నుంచి మా అన్నయ్య కనిపించట్లేదు.
తీసుకుని అమలు పెట్టు.
అది ఏమవుతా ఉన్నాడు?
లేదండి, ఆ రోజు నుంచి కనిపించట్లేదు. మీకేమైనా తెలుసా? తెలిస్తే కొంచెం చెప్తారా? అది ఏమైనా తెలిస్తే కొంచెం చెప్పండి. నేను కూడా చూస్తున్నాను. ఆ రింగ్ మీరా? అవునా? సరే, మా అన్నయ్య గురించి పోలీస్ స్టేషన్ లో కంప్లైంట్ ఇద్దాం అనుకుంటున్నాను. చూసుకోండి.
అంటే అది బాగుంది కదా అని మీకు ఎన్నిసార్లు చెప్పాలన్నా ఎవిడెన్స్ క్లియర్ చేయమని. ఎవరు ఎక్కువ ఎన్నిసార్లు చెప్పాలి జాగ్రత్త.
అది ఫిజికల్ దాంట్ ఉంది. ఏం చేయాలి?
దీన్ని కూడా ఇప్పుడే చంపేద్దామా? అనుకున్న ప్లాన్ కదా దాన్ని ఇప్పుడే ఏం చేయాలి అదే విషయం. ఇప్పుడు నిన్ను కూడా చంపబోతున్నాం. నీ కుటుంబంలో ఎవరిని లేకుండా చేస్తాం.
కొన్ని రోజుల తర్వాత కృష్ణ చెల్లెలు బాసర్ దగ్గర చెరువులో చనిపోయి
ఇక్కడే పిక్కలు పడుతుంది. డబుల్ కేస్. ఫారెన్సిక్ వాళ్ళు కూడా ఇక్కడ నుంచి ఎవిడెన్స్ కలెక్ట్ చేస్తున్నారు. ఎవిడెన్స్ మొత్తం మనం
While examining the sister's body, we found that the body was in late stage of decomposition with presence of adipose all over the body, and we could find a confusion over the right frontal region of head, along with the fracture of the frontal bone of the skull, with subarachnoid hemorrhage present over the frontal region of head and right side.
These were not isolated murders. An entire family was killed by the same purpose in a brutal way, and they are not hiding, waiting to be caught.
Sir, accused what is this saying?
Bro,
Hey, Bruno, Medina. Hey, Lilo.
నీకు ఫ్యామిలీ లేదు కాబట్టి దానిలో ఒక ఇల్లు కోసం ఒక ఫ్యామిలీ మొత్తాన్ని చంపుతారా?
మా ఫ్యామిలీ లేదా సార్, చిన్నప్పుడే గౌరవ మామూలు అధికారంగా చంపేశారు. ఎవరికి సార్ కుటుంబంలో అందరినీ చంపేశారు. ఇప్పుడు వాళ్ళ కుటుంబం కూడా సంభవం తీసుకొని రావాలి. కంప్లైంట్ రావాలి.
This was relied on certain judgments before that was based on gender identity, which is based on psychological and social factors. Then, following this, there is Transgender Persons Protection Act was introduced in 2019. And coming to the Transgender Amendment Bill, the discussion is about it. So the main key changes in this are the discussion included in this. So it removes the self-identification because it involves only the anatomical identification, limiting them to the genitals, and then it defines the roles of authorities like district magistrates and medical courts because they need to issue an certificate. Then it requires medical approval for their identity certification. The purpose of the amendments is very clear. That is for the it might affect. It has to reach the genuine transgender individuals. And then coming, there is stronger legal protection because there has been stricter punishments for offences for coercion, abduction, and forced mutilation. And also it limits to specific socio-cultural groups, and also it has excluded many identities. And then the state's perspective is that it should benefit genuine transgender individuals. Coming to the conclusion, removing self-identification may burden genuine individuals that might lead to repeated medical tests and bureaucratic procedures, which might create barriers in accessing the basic rights as well as the recognition, which is thereby a misguided move. And these are the references that I've taken from. And thank you.
What happened to the transgender bill?
So I think it will be it will be processed very soon.
You came across while studying?
Good evening everyone, I am Dr. R. Jagan, final year President, Osmania Medical College. I am presenting the case titled Confines Based Tragedy, Triple Fatality Due to Hydrogen Sulfide Poisoning in an Underground Sewage, guided by Dr. Surendra Rao sir, Assistant Professor. And coming to the introduction, hydrogen sulfide is a highly toxic and colorless gas. It is termed malodorous gas in most of the literature, and produced by anaerobic decomposition of organic matter in sewage and septic tanks, and also in volcanoes. It can cause rapid loss of consciousness, respiratory failure, and death due to inhibition of the cellular respiration, similar to that of like in cyanide poisoning. Coming to the case history, on 1st of March 2024 at 4:30 p.m., initially one victim, which you have been seeing here, one mark one, went into the sewage canal to remove the bags, which was placed to complete the drainage works in the past. So after the construction, they want to remove these bags. One guy went in and he immediately collapsed. To rescue the person who have collapsed, second person entered him. And while he was bringing him back, he tied a rope around his body, which is being held by the third person. So this guy, second guy, also lost his consciousness and pulled the third guy inside. So the third guy's head directly hit the bottom of the ground. So coming to the autopsy findings, there was rotten smell being, we have observed this pungent smell being emitted from these bodies, and congestion of the face, cyanotic changes, and swelling of the face was also observed in first and second victims more clearly. The third victim was rescued by another guy who used a scarf around his face, went inside and take him out. Even then, after coming out, he felt a bit nauseous and didn't enter back again. Now, after disaster rescue force have come and rescued, removed the bodies out and sent for postmortem examination. There are few raised abrasions on all of the three. And toxicological analysis have detected dihydrogen sulfide and metabolites thiosulfate in the blood and lung samples of all the three victims. And cause of death was dihydrogen sulfide poisoning in these victims 1 and 2, and head injury associated with dihydrogen sulfide poisoning in victim 3, as his head directly hit on the ground. But pathophysiology is inhibition of the cytochrome oxidase of the mitochondria, leading to aerobic cessation of the aerobic respiration, followed by lactic acidosis and oxidative stress, free radical damage of the cell, and leading to this. And level of HUS, level of HUS, according to the level of HUS, at 0.005 ppm, there will be rotten odor, and more than 100 ppm, local irritation, headache, and nausea can be seen. And something like above 700 ppm, it is called knockdown. With even a single breath is enough to kill that person. He will completely lose the consciousness. It is mostly used as a suicide thing in abroad. Something like they'll use the pool cleaners, hydrochloric acid and lime sulfur, which is used in the pesticides. They'll create this mixture and produce dihydrogen sulfide and use it as a suicidal method, as it is a painless death. And coming to the conclusion, this case represents a preventable confined space fatality due to dihydrogen sulfide exposure, with a rescue cascade phenomenon, highlighting critical failures in gas detection, ventilation and use of protective equipment, and raising medical legal concerns of occupational safety and negligence. Thank you. And thank you for the management, Telangana Academy of Forensic Medicine and Gandhi for Gandhi Medical College for giving this opportunity for presenting this. Actually, I followed up, sir. Even I tried to collect lead acetate strips in and around Hyderabad. We placed searched and I didn't actually found it. And I asked the police people if you have conducted any test after NDR rescue. They were they got a GCP and pulled everything apart. They gave me this answer. People to bring the nylon bags, we place them in them, and in sealed bags, we send the lung samples the same day without using any preservative. We want them that they should be sent the same day.
Quantitative analysis you are asking your person.
Yes, sir. We actually ordered for both qualitative and they just gave it as dihydrogen sulfate. Was detected in all the samples in all the victims that we have seen. Yes. So they didn't collect anything. They didn't collect.
Sulfite poison.
Yes.
Out of this one, which is fatal?
Huge fissure fracture, and also there is subdural hemorrhage, diffuse subdural hemorrhage, and as we got even H2 is positive in this case, we added the thing associated with dihydrogen sulfate also in this case.
You said it is 10 seconds. As per you,
immediately while you went in, they were able to visualize it. Yes.
injury or fatal.
In the third victim, sir, the rescue of the third, the time difference between entry of first victim and second victim is 10 seconds only. Second victim went within 10 seconds.
Among 4% population has suffered from depression, which are undiagnosed many times. Today, my topic is dual suicide and suicide, importance of psychiatric analysis. Suicide is a rare but devastating event where a parent kills their children following by suicide. It is frequently associated with underlying psychiatric illness, particularly depressive disorders in this case. A 32-year-old mother with no prior crime history allegedly killed her two sons who are 8 years and 5 years and subsequently died by suicide by jumping from an apartment. The forensic findings are, in scene examination, children found deceased inside the scene and there is no signs of any forced entry of struggles. Mother's body found below the beneath. Autopsy findings are, for both the children, the cause of death was multiple chop injuries to head, and the mother cause of death was initially opinion was reserved and was sent for carpusel analysis. Final report came and the report said there is no poisonous substance found in the reserve. We conclude the cause of death as head injury. Forensic psychiatric analysis. This case is consistent with altruistic suicide, where a parent believes death in the child's best interest, often associated with major depressive disorder, psychosis, suicidal ideation. Key features in this case: preoccupation with children's future welfare, possible distorted cognition. Children cannot survive without me. Planned sequence: suicide followed by suicide. Discussion. Majority of the suicide cases involves mother with untreated psychiatric illness. Warning signs often missed: withdrawal, expressive hopelessness, overprotectiveness, or fatalistic belief. Early psychiatric intervention could be prevented. Conclusion. Suicide in this case represents psychiatric pathology rather than criminal intent alone. Early identification and treatment of the mental illness is life-saving. Preventive strategies, psychiatric screening, family support system. And my references are nice.
Psychiatric illness and other things. I mean, visited the history whether the mother is suffering from any psychiatric illness, mental illness. She is on medication. She is not under any medication, not under any treatment. But the relative said she is having some psychiatric illness and she have these features like low energy, low mood, low interest. No, any medication, prescriptions, treatment history, then we cannot believe those persons who are telling. Then what is fratricide? You said about penicillin. What is fratricide? Fratricide. Relativity or IC.
Right? She was charged for murder.
She died.
She also died.
What? How?
Followed by suicide. Yes, sir. There is specific terminology for this. The type of death this was. What is it? Died in death.
I'm Dr. Nazisha, second year resident from Government Medical College, Nalgonda. I'm a line Dr. K. Professor. And today I'm going to present a case about a rare case of manual strangulation with cervical vertebrae fracture in homicidal assault. Going to the introduction, neck compression is a well-recognized cause of homicidal asphyxia. However, the absence of external findings helps solve the diagnosis. Manual strangulation when present without visible marks, necessitating careful internal examination of neck structures. Fatal assaults may involve multiple overlapping mechanisms, including asphyxia, neurological, circulatory, requiring thorough correlation. Coming to the case history, an adult male of 35 years was brought to the government GGH Nalgonda on 20th January 26 for medical legal autopsy. As for the history provided, there had been a frequent marital disputes over for 10 to 15 days due to the alleged extramarital involvement of the spouse. On the night of 27 January 2026, a violent altercation reportedly occurred at the residence during which the deceased was assaulted. The assault involved blunt force impact, including occipital region with a forceful neck compression and manipulation. On the morning of 28 January 26, the deceased was found lying unresponsive on the bed with bleeding from the nose. The spouse was initially absent from the scene, raising suspicion. So police were informed and inquest was conducted and the body was referred to for the medical legal autopsy to determine the cause of death. Coming to the autopsy findings, external findings were facial congestion, subconjunctival hemorrhage, pingus discoloration over the neck and upper chest, and multiple abrasions and contusions over the face, neck and trunk, and massive total swelling. Internal findings, we found the skull contusions and we have diffuse subdural and subarachnoid hemorrhage, neck that is strap muscle contusions, but higher thyroid cartilage was intact. And we have fracture dislocation of C3 vertebrae with spinal cord transection, chest constriction, and in abdomen we have mesenteric contusion with 200 to 300 ml of hemiperitoneum, and in the over the genital area we have severe scrotal trauma with hematoma. Coming to the discussion, this case represents a multifactorial homicidal death. Asphyxial components, manual strangulation and chest compression will give the facial congestion, subconjunctival hemorrhage. When coming to the neurological components, C3 fracture dislocation with spinal cord transection with subarachnoid hemorrhage, subdural hemorrhage, which caused a rapid fatal outcome, associated blunt force trauma, occipital injury, mesenteric hemorrhage, and severe scrotal trauma. So, despite the absence of external neck marks and intact hyoid, deep strap muscles hemorrhage confirm the neck compression. Coming to the conclusion, death is due to the cervical spine injury, that is C3 dislocation with spinal cord transection, associated with neck compression with multiple blunt force injuries. This case highlights the importance of meticulous internal examination in detecting the neck injuries and emphasizes that the absence of external signs does not exclude the manual strangulation. It further demonstrates how multiple mechanisms may act synergistically to cause death in homicidal assaults. Manual strangulation for 14 minutes.
Any internal acids or external acids inside?
There was conditions here.
It's like pictures in small things. It doesn't carry any sense.
Yes.
And what is the importance of putting a genital pictures in one of the pictures there?
Yes, violent conduct. So there was a stamping on it. The woman who committed this crime, which is continuously stamped on the scrotal area, which caused scrotal injuries. Serious scrotal injury was there. From behind, sir, with the weapon.
Yeah, you were showing the weapon over.
Yes, sir. So this was the weapon, sir.
Yeah.
Pistol. So then he fell on his face. Then there was a hit with the weapon, which causes the blunt injuries. Then the deceased was turned on the supine position. Then the stamping was made. And then she sat on the chest and throttled him, sir.
Yeah, my question is still the same. What is the relationship with manual strangulation cervical fracture? Why not the physical assault led to the fracture of the C3 vertebra?
Yes.
It could be because of physical assault, not because of throttling.
But throttling may act associated with its
See, whether it was a fracture dislocation or only dislocation. Whether the body of